Good morning. Welcome to the second hearing of Portfolio Committee Number 2 Health for the additional round of the inquiry into budget estimates 2024-2025. I acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the lands on which we're meeting today. I pay my respects to elders past and present and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I also acknowledge and pay my respects to any Aboriginal and Torres Strait Islander people joining us today. My name's Dr. Amanda Conn and I'm Chair of the committee. I welcome Minister Jackson and accompanying officials to the hearing. Today the committee will examine the proposed expenditure for the portfolios of water, housing, homelessness, mental health, youth and the North Coast. And I thank the Minister and witnesses for being able to very promptly reschedule this hearing, having deferred it last week because of Cyclone Alfred. I ask everyone in the room to please turn their mobile phones to silent. Parliamentary privilege applies to witnesses in relation to the evidence they give today. However, it does not apply to what witnesses say outside of the hearing. I urge witnesses to be careful about making comments to the media or to others after completing their evidence. In addition, the Legislative Council has adopted rules to provide procedural fairness for inquiry participants. I encourage committee members and witnesses to be mindful of these procedures. Whilst all witnesses must be sworn prior to giving evidence, Minister, I remind you that you do not need to be sworn as you've already sworn an oath to your office as a Member of Parliament. I'd also like to remind all other witnesses that you do not need to be sworn as you've already been sworn before this committee during this inquiry. I note that there are witnesses in the overflow seating area today. I'd like to remind you that if you come forward to answer a question, to please bring your nameplate with you and place it in front of you at the table. This assists Hansard in ensuring the correct witness is identified in the hearing transcript. Today's hearing will be conducted from 9:15 to 5:30. We're joined by the Minister for the morning session from 9:15 to 1 with a 15-minute break at 11 o'clock. In the afternoon, we'll hear from the departmental witnesses from 2 to 5:30 p.m. with a 15-minute break at 3:30. And Mr. Tidball will be joining from 2:40 p.m. During these sessions, there'll be questions. Yeah, he's here. Yeah. Okay. Thank you. My apologies. The script wasn't updated from last week.
I'll come early.
That was from the last week program.
Hey, enjoy.
Right, yeah.
Thank you and welcome. During the sessions, there'll be questions from the opposition and the crossbench members only, and then 15 minutes allocated for government questions at 10:45, 12:45 and 5:15. And we'll begin with questions from the opposition.
Thank you very much. First of all, can I thank everyone for being here, and also particularly for the department staff and staff on the ground who have been helping with Cyclone Alfred. Really is appreciated, so thank you. Minister, how many full-time staff specialist psychiatrists held permanent positions in New South Wales Health as of the 28th of December 2024, and how many are currently employed?
I might ask Susan just to confirm that the numbers that I have are accurate. So I have the workforce headcount, and just obviously to be clear, there's a difference between headcount and FTE. Many of these people do not work full-time, but I have the workforce headcount at 443. As I said, that is not FTE positions, that's headcount, and I don't have a breakdown there of who's working full-time, part-time, or what the structures are. So that's what I have the headcount as. And what was
how many are currently, what's their headcount as of today?
The headcount as of today, Susan, if you have that number.
So sorry, Minister, just the 443, when's that from?
That is my understanding of the headcount that is funded by New South Wales Health to work across the district. So that hasn't changed. We fund a headcount of that, but as I said, those positions are not all filled at the moment, and they're certainly not all filled full time.
And of the 28th of December, how many of those positions were filled?
Susan, do you have that as of 28th of December?
Not as the 28th of December. We'd have to take that on notice and come back to you. We can try and do that in the session today.
Yeah.
Do you have any date similar around that in December?
Not on me at the present time, no.
Do you know how many are employed as of today?
Take it on notice, given that obviously we have had some resignations since that date, so we can take that on notice.
Can I ask, Minister, when was the last time you asked what the headcount was?
Well, I mean, I'm constantly receiving information as to how many separations have been finalised, how many have transferred to VMO. So, I mean, again, in terms of your question about the headcount, there is a difference between a staff specialist and a VMO in terms of the way that we account for that. But actually, that is a person who is working in New South Wales Health delivering a service. So in some ways, what I want to know and what I'm constantly being updated on is, do we have enough people in the system, whether they are staff specialists, whether they're VMOs, or whether they're locums, to deliver the quality of care that we expect to be delivered.
But Minister, I can accept that you may not have at hand the numbers last year, but I would expect that you would know how many full-time specialist positions are currently either today or yesterday or when you were last updated. And coming to budget estimates, I would expect that you would have that information.
Well, as I said, I mean, we do have information about how many people are working in different roles in different districts, but it is not straightforward, as it is in fact changing every single day. I mean,
Well, Minister, do you have the breakdown? Specialist, VMOs, locums, do you have that breakdown?
As of today, I mean, not at my fingertips, but we can see if that particular information is something that you wish to know. I mean, I do, for example, know that, you know, we have people who have transferred to VMO roles, people who are working as locums, separations that have been finalised, people that have deferred their resignation. So that broad information is something that we're constantly being updated on. But within the cohort of people who are currently delivering care today across the LHDs, we can try
Minister,
and get that
do you think it's
breakdown.
acceptable that you come to budget estimates and you're not fully prepared?
No,
You said you received updates, you've got an entire room full of officials, and yet you can't answer simple questions of exactly how many people are currently employed.
Well, I mean, as I said, the reason that is a somewhat difficult question to answer is because we are right in the middle of a situation, a well-known situation,
Hence
in
our
which
question.
those numbers are changing, and we are able to get the information that we need to provide the confidence that we need to have that the care is being delivered as best it can be. But in terms of a breakdown across the districts, across the different hospitals, it's a situation that changes every day.
I didn't actually ask for the breakdown across the districts, I asked specifically for the figure. And you don't know how many people are currently employed full-time in those specialist roles.
Well, I mean, as I said, you've then changed the question even then to say full-time. Well, that's
No, that was the original question,
That's
Minister.
actually not straightforward.
Full-time, I know, and I took that on board when you said it's actually about headcount, and I'm happy to change that terminology, but you still can't give me that figure.
Well, I mean, that
and
figure,
I think
that
as a
figure that
minister
I
coming to
gave
budget
you-
estimates, you should be across those details. I might move on. Minister, the arbitration hearings next week are formally listed for the arbitration of Psychiatry Staff Specialist Attraction and Retention State Interim Award 2025. Clearly the government's offer of 10.5% wage increase over the next 3 years and an additional 10% onerous duties allowance was not capable of retaining, let alone attracting psychiatrists as specialist staff. Is the Australian Salaried Medical Officers Federation current assertion that the government has not increased or varied this offer ahead of the arbitration, and that in fact that there has been no meaningful negotiations ahead of the arbitration? Is that correct?
No. that's
What
not correct.
has occurred?
I mean, we have been meeting with them ahead of the arbitration for a substantial period of time, including more recent meetings since the arbitration was listed. We have made various offers in relation to increases in wages, all of which I should note exceed the previous wage cap policy of your government, but nonetheless we've made various offers. Base increase in wages, as you mentioned, the onerous duties allowance, various provisions for non-award improvements. We have a whole plan that we're hopeful to work with the psychiatrists on in relation to improvements of things in their workplace outside of award provisions. The trial or the pilot of other productivity savings and work, you know, that was also put on the table. That I feel as though we have made various offers across the spectrum of wage increases, condition improvements, special allowances and duties, pilots of more opportunities to improve the nature of the work that our staff specialists do. And at every single one of those moments where we've put those offers on the table, we've been met with no, it's a 25% increase right now or nothing. And so, yeah, that has led to a circumstance where we haven't been able to agree. Because despite everything that I've articulated that we've put forward in good faith to try and resolve this, all that we have been met with in return is undo 12 years of wage suppression in 12 months. And
When was the last time you met?
I can take that on notice, although I think it was a few weeks ago. I don't have the date. I can check that. It was within the last few weeks.
Yeah, I'm just sorry, Minister. I just wanted to go back to the figures, and you said that you didn't have any sort of numbers with you, but we did ask you about this in the House, and you did. I think we're talking about the 200 sort of expected resignations, and I think you indicated that about sort of 50 odd had their separations finalised. The Premier in his budget estimates hearing said that there were 52 resignations finalised by the 10th of February. There were 72 who'd been moved to VMOs. Is there any further breakdown on those? Do you have any new numbers from the last month that you can give us so that there is some data that you can provide today?
Sure, as I said. So we have a workforce headcount of 443. As you've mentioned, at its peak, we had received 206 indications of an intention to resign. We now have 62 resignations processed and finalised. So that is a number that's
increased from the last data you gave us.
Yes.
Thank you.
We have 38 resignations withdrawn. We have 72 staff who've agreed to transition to VMO roles. So as I said, they are people that continue to provide care in the public system, yes, in a different contractual arrangement with New South Wales Health, but nonetheless, in terms of a head count of people who are providing care in the public system, VMOs are playing that role, and we have 109 resignations deferred. So that's the latest. As I said, I am being briefed constantly in terms of that evolving situation, and as you can see, Ms Mitchell, the numbers do change.
Yeah,
they do. Those resignations deferred, for example, I'll always be very honest, some of those deferrals may well be an intention to resign next week. Some of them, I understand, are as long away as November. That's correct, isn't it, Ms Pearce? So that number, for example, is changing. And, you know, sometimes that is why you will see the resignations processed and finalised increase, because some people are, as time goes on, choosing to go down that path. And once again,
so of the 443, just so I'm clear, you've had 62 have their resignations finalised, 38 have withdrawn, 72 going to VMOs, and 109 sort of deferring their resignation. So all up, that's 281. Now, I respect with the 38 withdrawn, you could argue that comes back sort of closer to 240, but it's at least half of the workforce that are involved in this concern at the moment.
That's a fair characterisation.
And slightly higher than the 200 that we talked about previously, if you add those figures together.
Well, yeah, I mean, except that the actual comparison in my mind, Ms Mitchell, is between 206 and 62, because 206 people indicated that they intended to resign.
But in your words, Minister, you've got 109 that could leave next week.
62 have done that. Now, I mean, I'm not trying. Your basic characterisation at the beginning of your question, which is a large portion of the workforce are unhappy with the current remuneration and are indicating either through resignation or through signalling an intention to resign or transitioning to VMO, that they're unhappy with that. I accept that. I've always accepted that these are valid and legitimate issues that need to be resolved. That's why we've met many, many times. That's why we've put all of those offers on the table. And yes, we were unable to reach agreement. That's why we've listed this matter for urgent specialist arbitration next week. We wouldn't have done those things if we didn't take it seriously and think it was serious. And it is serious. It is serious.
Very serious.
Minister, just on, you said 72 VMOs have been engaged. What is the cost?
We don't have that figure because it is as yet undetermined. There is a cost, absolutely no doubt that there is a cost, but those 72 VMO contracts are all potentially slightly varied contracts. So whilst New South Wales Health has provided...
I might rephrase it,
average-
Minister, is the current salary of a staff specialist in a hospital versus that of the VMO, are you saying that you've varied those contracts so the salary is the same, or are you paying them more?
No, what I'm saying is when we engage someone as a VMO, that is done at a district by district level. And the conditions and the wages of those VMOs vary district by district. Now, New South Wales Health has provided a framework for districts to negotiate those contracts, but I'm correct, aren't I, Ms. Pearce, that it's not a when we say VMO, it's not a single contract, a single wage rate, a single framework. It varies.
But it is fair to say that they get paid more. And what's the average percentage?
I don't think that is an accurate description, Ms. McLaren-Jones. The rates for VMOs, for example, don't include annual leave and other things that staff specialists attract. The locum rate, again, a separate issue. We set a rate to prevent any attempt to escalate those rates in the context of this situation. But the point that I would make about this issue substantively is that this is a temporary arrangement. This is not designed for the future. We have made these arrangements on a temporary basis, which is why there is a large number of our staff specialist psychiatrists who've deferred their resignations. A number of those people have taken up the VMO option whilst they await the outcome of the Industrial Commission process.
So, Minister, are you actually saying, so there's 72 VMOs, you cannot tell us now what that is costing the state government?
Well, no, because
You can't put even a ballpark figure on it. You have no idea?
we take our oaths to give honest answers here quite seriously. Because this is a evolving, ongoing, albeit hopefully temporary situation, the cost differential between what we would hypothetically be paying staff specialists and those VMO contracts, which, as I said, vary district by district, is not something that we have.
But haven't you asked? Like, how do you not know what it's costing you? I just find that bizarre.
Well,
And that you haven't asked.
well, I mean, of course, we talk constantly about how we are managing this circumstance. Again, district by district. But it varies. It varies.
Okay, well, give me an example. If it varies,
Well, as an example,
pick one example, one health district, and what you're paying for VMOs.
as an example, if I were to say, what is the cost of employing VMOs across New South Wales health districts, and then present that figure as though that cost is associated with this current industrial campaign, that would be inaccurate, Ms. Mitchell, because, for example, Far West LHD previously was entirely VMO-based psychiatry. That's correct, isn't it? There was no staff specialist.
I'm not arguing that with you,
Well,
but I'm wanting to know, you've got 72 people who used to be staff specialists who are now VMOs. What is the cost? Like, this is not a trick question. You are the Minister for Mental Health, and you cannot tell this committee today in budget estimates what that is costing the state.
Because
that is just
presenting,
not good enough.
You're presenting that as though that is a figure that we would just plug into the system and produce. Those 72 people, as I said, are based across different districts with different contractual
Someone's paying
arrangements.
them.
They're
What's
not
payroll?
all. They're not all full time. They're not all full time.
Again, that's not
Some
my
of them are
question.
working 1 day a week.
Are
Some
they
of
getting
them are
paid,
working
Minister,
5
at the
days a
moment?
week.
Are they getting a pay? Well, then what are you paying them? What's the payroll costing
well, I mean-
you? Like, surely you know the answer to
Well,
that.
of course, we can give you information
Yeah,
about.
but that's what
for
I'm
ex-
asking for. I mean,
Well-
this is a farce.
No, I mean, for example, we could provide information about what the standard VMO rates are.
That'd be a start.
Ms. Pearce, did you want to provide some
And of those
information?
Take it 10
72.
minutes to get that.
And then secondly, and I'm happy for you to take on note, but of those 72, how much you are paying and what is the overall cost to the state?
Well, we can take that on notice for a point in time, but I'll restate the point that I made earlier. VMOs can be employed in different ways. They can be employed for sessional arrangements. They're employed fractionally. So it's not necessarily a like-for-like situation. There are complexities, but we're happy to provide on notice what we're paying VMOs in these circumstances. As I also said, we were very clear about the locum rate. We've made this point publicly a number of times of $3,050 per day for locums, which are separate to VMOs, in an effort to avoid a situation where we were being frankly price gouged around the use of locums. The other point that I will make is that we've recruited 72 locums during the course of this dispute. We have deployed 27 of those. So we have plenty of reserve in respect of locums for the system should they need it. We're in constant contact with the health system in that regard. And we've worked very hard over these months to ensure that we're deploying staff where they are needed. We have made it very clear to our staff specialist psychiatrists that they're valued by the health system. I've personally written to them 3 times, asking them not to go through with this. But the current issue for us is that it is in the place that it belongs, and that is in the Industrial Commission, and we look forward to participating in that hearing over the coming weeks.
Do you know how much the cost of the virtual hubs that have been set up?
Do we have a cost of that?
We can take that on notice. I mean, we already had virtual arrangements in place, so I'd make the point. And again, to be very clear about the care of mental health patients in this state, we do not seek to single out mental health patients in the way we arrange our budget. We have virtual services right across the state for all manner of things, including children, adults, etc. So whilst we can seek to understand the proportion associated with the virtual hub, what I would say to you is that those technologies which became very important to us during the pandemic have continued to evolve across the state and will continue to evolve.
I can understand that, but you can see our concern. We've asked a number of questions. This is budget estimates, and the Minister is unable to provide basic answers in relation to budgetary matters, and it's extremely disappointing. Shocking, actually.
Good morning, Minister. You've recently confirmed that part of your contingency plan to cope with the resignation of the staff specialist psychiatrists includes considering declaring private hospitals for the admission of involuntary patients. How can you ensure that care is being provided through the least restrictive means when there is a profit motive for the admission of those patients?
Yeah, I mean, look, I mean, I might ask Ms. Pearce or Dr. Wright to comment as well, but I would say my understanding, Dr. Con, is that whilst that is a part, as you acknowledge, of the contingency planning that we have put in place, again, to reiterate, I wish we didn't need contingency planning. This is a temporary response to the industrial dispute that we're having. My understanding is that at present no private facilities have in fact been gazetted to receive involuntary admissions. And in terms of the question that you asked, which is how in an at present hypothetical scenario where that were to occur, and because we are in the Commission next week, I'm obviously hopeful that we will not need to activate that part of the contingency planning. At present we have not, and I'm hopeful that we do not have to. I might ask Dr. Wright to talk about what we have done to ensure that if hypothetically we did need to do that, that our commitment to least restrictive care was core to that arrangement.
Thank you. So I think that in the build-up to the process of a declaration in a private facility, there's an awful lot of work that goes on between the regulatory part of New South Wales Health and any service provider in the private sector. So there's there's 2 broad elements there. One is about the appropriateness of the facility and the support services in that facility. because you'd appreciate that there's a very high standard of facility design that's required for involuntary care, but there's also a very high level of standards of care and accreditation that has to happen, and that gets run past our legal branch and our licensing branch in consultation, and this is also important, in consultation with the local health district within which the private facility sits. And so the process, and I'll probably describe a scenario which might help. It's not a process of any person who might be needing inpatient care being suitable to go into that sort of environment. So the scenario that I would be thinking of is an individual who, for instance, might have a very, very serious and potentially life-threatening depression, who's requiring ECT as part of their treatment. They are still at risk, and they are considered as an involuntary patient because they're not sufficiently attending to their needs in terms of food, drink, etc., etc. And they are recovering, and they are considered suitable to go into to be looked after within a private setting. Many of our private facilities in Sydney have excellent and well-regarded mood disorder services.
Thank you. So, Dr. Rudd, I'll just interrupt you because I'm happy to come back this afternoon to the level of staffing and facilities, which is important, and I understand there are concerns about that. But while we've got the Minister, I'm specifically interested in this issue of conflict of interest.
Yeah.
And if you look at the Schedule 1 form, and I've brought a copy if other committee members are interested, there's specifically a section that requires a declaration of pecuniary interest in a private mental health facility or in the admission of a person. What actually happens if a doctor fills that out and says, yes, I have a pecuniary conflict of interest, I will receive a payment from the government for admitting this person against their will? My understanding is there's nothing that actually links this form to the Act to say that that person then won't be admitted.
Yeah, I mean, I think, again, I might ask Dr. Wright to comment, but I understand the point you're making, Dr. Con, but I have to say that the assertion that you are making that all providers, practitioners who work in private practice are motivated by profit, I don't think
Sorry,
is a
Minister.
fair characterisation.
I need to correct you because it's not the assertion I've made. What I'm trying to do is establish safeguards for least restrictive care for people, and as you would know, that's a serious concern for people living with mental illness.
I do understand that, and Dr. Wright's talked you through that, but the suggestion that those conflict of interest provisions are related to specific pecuniary interests that medical professionals might have. Your suggestion is not that. Your suggestion is that any doctor administering care in a private facility to a public patient has a broad profit motive, and I just don't think that is consistent.
Minister, I need to correct you again because you're commenting on what you think I've asserted. My understanding is that under your contingency plan, the government is remunerating psychiatrists employed by private hospitals per patient per week for the care of public patients. Is that not the case, and is that not a profit motive for the admission of involuntary patients?
Well, I mean, again, I can ask Dr. Wright or Ms. Pearce to comment. I mean, we have long-standing and ongoing relationships between our public health facilities and our private health facilities. That's not new. That's
for
not
voluntary
new.
patients.
That's right. And as I've already indicated, your questioning, while valid, is on a hypothetical scenario that we have not activated and we hope not to activate. But I do want to assure you that in the development of these contingency plans, the issues that you have raised around how we might manage that circumstance has been the subject of significant discussion and deliberation amongst our team because of the issues that you've raised. We do take them seriously. I mean, did you want to comment, Dr. Wright, specifically on the form, the Schedule 1 form that Dr. Con has raised, or she will be able to ask you questions this afternoon, but if you had something on that.
Well, I think it goes to the issue of governance, and we've had these very discussions within the group of directors of mental health who we're meeting every week to discuss these things. And the governance side of this is that we would anticipate, if this comes to fruition, that the admission would occur by way of referral from within the public sector. So the first thing is that we would decide that this was an appropriate thing to occur. And our expectation is that our service stays in very regular contact with the private facility and has some say over what happens while the person is in the private facility. So it's not a referral which is instigated by the private facility. It is instigated by our services, and then
Can I just clarify something? Because I think this is really important. So are you saying that if a private facility is declared for admission of involuntary patients, they won't be permitted to admit directly into that private hospital? They would have to come through
Not under
the
this
public
situation.
hospital first?
This situation is about us managing the scenario where we don't have the capacity, the bed capacity, because of a loss of staff.
I
And so
understand that, but
that's what
under the
contingency is there
declaration,
for.
would the private hospital be able to admit directly
No.
involuntary
That is
patients?
not our expectation or intention. To be very clear, as Dr. Wright said, this is a hypothetical situation which we have not encountered and hope not to. But in the contingency planning, because we took the contingency planning very seriously, this was contemplated as an option. In that scenario, as Dr. Wright has said, it would be because a public facility, unfortunately, was not able to deliver that care because of a lack of bed capacity, and that we would manage a transfer and oversee care in a private facility in an involuntary arrangement. But as I said, that has not happened. In fact, no gazettal has even been made to allow that to happen. And we are hopeful, with the arbitration to occur next week, that we can avoid that scenario.
Thank you, Minister. I just wanted to quote you, if I may, in the context of private prisons in New South Wales. So you've said privatising prisons is bad policy. Private companies should not be able to make profit from the incarceration of people. They're fundamentally incentivised to get more people into prisons, more profit from the bottom line, when the public policy goal should be that an experience in prison is a fundamental circuit breaker for someone who is on the wrong track, and that every effort's made to ensure when that person is out of prison, their life is changed and they don't turn around and commit more crime. Now, appreciate that involuntary mental health patients are not criminals. I'm not making that connection. But you can see the analogy here that this privatisation of inpatient mental health care is analogous to private prisons. How do you deal with that hypocrisy in your
I
policy?
stand by my comments in relation to private prisons, and very proud to have been part of a government that has brought Junee and Parkley back in-house. But in answer to your question, this is not a policy position that the government has adopted and promoted as a proactive change to the way that mental health care is delivered in New South Wales. That is not what is happening. This is a reactive, temporary contingency to what we hope is a short-term dispute. I obviously would prefer, and happy to be on the record, we would like that care to be delivered in an if indeed an involuntary admission is necessary, in a public facility. That is our preference. The only circumstance in which that is even hypothetically contemplated to not occur is because we literally cannot deliver that care, because we do not have the psychiatrists available to manage those patients and those beds. Now, thankfully, despite the industrial issues, that hasn't occurred. But it is very different, Dr. Con, to me deciding this is something we want for the public system. That's not what's happened. This is a very narrow contingency for a circumstance that was not of our will, not of our creation, not of our desire.
I'll go to Ms Fairman.
Thank you, Chair. Morning, Minister. Minister, this government and the previous government have committed to developing an Aboriginal water strategy. The consultation paper was on public display last year. It identified 6 principles, including economic benefit. So are you committed to those 6 principles, particularly in terms of economic benefit to Aboriginal people through the access of water?
Yes, we are.
Okay, so the water sharing plans, I understand, included an objective for Aboriginal cultural outcomes. The performance indicators to achieve those outcomes relate to the first is the extent to which native title rights are able to be exercised consistently with any determination of native title or Indigenous land use agreement, and secondly, environmental outcomes. So wouldn't it make sense for the water sharing plans to be amended to reflect strategies and performance indicators that achieve economic benefit for Aboriginal people? Because they're not in there at the moment.
I mean, look, I have no reason to think that that would not be a potentially sensible amendment. I suspect that part of what is happening is we have not yet finalised the Aboriginal water strategy, and part of that is because we are very committed to working closely and in partnership with First Nations people, and their feedback and engagement on that strategy is critically important to me. I mean, to be perfectly honest, Ms. Fairman, I could have just grabbed a doc, done a bit of kind of light touch consultation, put a nice design on the cover, put it out, ticked that box. I didn't want to do that. I wanted to make it a strategy that was deeply owned by Aboriginal people. That has taken more time. Okay. But in answer to your question, I mean, we are always open, and in fact going through remake of a number of plans now, and always open to amendment in the public interest, which, as you know, can happen outside the remake timetable.
So that's good, because I'm getting to
Sure.
the water sharing plans.
Yep.
In terms of questions. So the water sharing plans, as you know, were amended in October last year through the Water Sharing Plan Amendment Omnibus Order 2024. One of those amendments related to conditions on the special purpose access licences for Aboriginal cultural access. And it says any commercial benefit obtained by the taking or use of water is only ancillary or incidental to the purpose for which the water is taken. So why were the water sharing plans amended last year to explicitly deny commercial benefit arising from the use of Aboriginal cultural water access licences?
I don't feel as though that is a fair characterisation of that provision. It does not explicitly exclude that. What it does is suggest that the purpose, the primary purpose of that take should not be commercial. They are not intended. They are not intended as commercial licences. They are intended as Aboriginal cultural water licences. In fact, the provision does recognise that there may be a commercial or economic benefit, and that is allowed for, but that needs to be ancillary. That needs to be ancillary. And I'm quite comfortable with that, Ms. Fairman.
What's like the definition of, what does that mean? What's an example? And who kind of advocated for that in terms of that amendment last year?
I am not sure the answer to that question of who advocated for that. Ms. Jones, do you have an answer to that? But as I said, I understand this issue that you're raising. I'm across the desire of Aboriginal communities to have increased ownership of water and to be able to use that ownership to deliver economic benefits to their communities. And I am supportive of that. But that does not mean that the primary purpose of those licences should be commercial. As I said,
So why not?
Well, because the primary purpose is to deliver cultural benefit to those communities. And that, when I talk to First Nations communities, as I'm sure you do too, whilst they are interested in using that ownership to deliver economic benefit, and I'm supportive of that, their primary interest is to reflect their cultural connection to water and land.
But why would you explicitly
It's not
put in
explicit.
legislation, it is explicit that it has to be ancillary or incidental? I mean, can't we leave that to them?
Well, as I said, my view of the interpretation of those provisions is that it appropriately reflects the fact that the purpose of those licences is cultural benefit. Access to water at special places, at watering holes, delivering water to cultural sites that are of significance to First Nations people, and I fully support that, and I accept that part of that may deliver economic benefit, but that isn't the primary purpose. That it
Okay.
is indeed ancillary to a cultural outcome.
Okay, so I do need to move on, unfortunately, in terms of time, but I appreciate that. Thank you. Minister, who's the New South Wales Environmental Water Manager?
That would be someone within BCS, I imagine. So someone within Minister Sharp's area. Is that correct, Ms
That's
Jones? Is
correct.
there an individual who holds that title under Minister Sharp?
Not the actual title, but yes, the function is managed in Minister Sharp's
The function,
portfolio. Yeah.
Yeah, so therefore, in terms of the Minister responsible for ensuring that obligations are met under the Ramsar Convention on Wetlands, that's also...
I think that would be a shared responsibility, but yes, I mean, Minister Sharp is responsible for the management of environmental water within New South Wales. But I mean,
Yes.
I also take meeting our Ramsar wetlands obligations very
Thank you.
seriously.
I have heard from some water stakeholders that there's a little bit passing responsibility between the two officers. I did want to get on the record for the purpose of...
That's fine. I'm happy to place that on the record.
Environment Minister, that is the Environmental Water
That's fine.
Manager. Thank you. Minister, you will know that the water sharing plans for regulated valleys in New South Wales Basin contain 3 limits on water extracted for irrigation. Obviously the Murray-Darling Basin Cap, the Basin Plan SDL, as well as the long-term annual average extraction limit. How important are these limits to managing how much water is extracted in those valleys, and is it possible to manage water extractions without those limits?
They are very important, and no, it is not.
So you'll also know that the water sharing plans for regulated valleys in the Murray-Darling Basin Plan have recently been amended to give effect to the plan. Given the importance of the limits in what you said in managing water extractions, why have all volumetric limits been removed from the amended water sharing plans? Everyone except the Namoy, I understand.
Yeah, I mean, I think I might ask Ms Jones to clarify. We have a quite significant piece of work that the water group is undertaking to move towards finalising those volumetric limits. But it is not straightforward, particularly on the long-term average extraction, the LTALs. It is not straightforward. It is a significant piece of work, and, you know, rightfully informed by updated science on climate change and all of those things. But
Who removed the volumetric limits? Why were they removed? The Natural Resources Commissioner isn't happy about it.
I'm not understanding.
yes,
the
I don't
exact
think that
question.
my understanding, Ms Pham, and we're happy to take this on notice.
Yeah.
My understanding is that there are not volumetric limits in the plans, but that there never were. The commitment that, in terms of LTALs, the commitment that we've given over time is to introduce them, and certainly the Natural Resources Commission have signalled that that is what they would desire us to do, but that no volumetric limits in the way that you have described were removed from the plans. That's not my understanding.
Yeah, I think if this is in regard to the inland unregulated plans, it's that up to now, there's been a description of the limit. There hasn't been a volume. And that's because these are areas where there's very low metering and there's very low abstraction, actually, of water.
These are
And so-
regulated. These are regulated.
Look, we may have to take that on notice, Ms Fairman. As I said, I am aware that there is a desire from the Natural Resources Commission for us to move towards more clear volumetric limits in relation to some of those extraction
Well, he said,
thresholds.
like in relation to the Murrumbidgee regulated river, the Natural Resources Commissioner said that a fundamental role of a water sharing plan is to establish limits on the volume
Yes.
of water that can be extracted, and then says that the issue that plans do not include numeric long-term
Yes.
average annual extraction limits for the water sources they govern create a material risk that the water sharing plans are not achieving their intended outcomes. That's Murrumbidgee and others.
Yes, and so just to clarify, I am aware of that. The limits were not removed. They are not. They are not present. The Natural Resources Commissioner is correct about that, and we are across that. We are moving towards that, but it is a significant piece of work that involves substantial analysis and modelling, and in fact much improved metering than we have. But I've been clear that that is something that I am committed to moving towards. But it's not as though there were those things in the
I
plans
think you're
that were
mistaken,
removed.
Minister. I'll come back to that.
Thank you, Minister. On the 13th of October 2023, you received a joint letter from the Australian Salaries Medical Officers Federation, the Australian Medical Association and the Royal Australian New Zealand College of Psychiatrists, highlighting the psychiatry workforce crisis. You've had 15 months to address this issue, and yet you haven't. Why not?
Oh, because despite the fact that I've had numerous meetings with representatives of those groups, put what I consider to be a wide spread and breadth of offers on the table.
When did those meetings first commence? Was it 15 months ago or more recently?
They commenced some time ago. I can't recall the first time that I met with representatives of that group, although it was some time ago. I will openly admit that I have been meeting with representatives of the college and ASMOF and the AMA for some time about this matter. And the reason that despite that length of time and that number of meetings that it has not been able to be resolved is that we've made offer after offer after offer, and every single time have been met with a response of no, the only thing we will accept is a 25% wage determination right now. And I've been clear that is not something that the government can reasonably accede to. So it is unfortunate to me that it has not been resolved. I wish it had been, but it is not for want of lack of trying on our part. I genuinely believe that. In
Minister,
a
can you take
negotiation,
on notice-
you put things forward, and the expectation is that
Minister,
the other
we're
party...
aware of this, we've heard. Can you take on notice when you first met with them following that piece of correspondence from October 2023, when you first met with them to discuss this issue, not broad meetings, but to discuss this specific issue, and when you began to put offers on the table?
I will take on notice. I will take that on notice, although I will also I will take that on notice. I will also indicate that in 2023, the government delivered a 4.5% pay rise to all public servants, which was the largest pay rise
Minister, we're
that staff
asking
specialist
about this
psychiatrists had
particular
received in over a
crisis
decade. So
that you've known about.
we were signalling from that point in that year our willingness to do more to support our public servants. But yes, I'll take on notice the exact meeting.
Minister,
dates.
following with impending mass resignations, do you think it was appropriate that both yourself and the Minister for Health took gazetted leave from the 11th to the 20th of January this year?
I've discussed this matter in the Parliament before, and I just reiterate my point that, yes, I do think in the circumstances my taking a holiday with my family in early January was appropriate. The reason that I think that...
But Minister, it's about both yourself and the Minister for Health. Did you raise with the Minister for Health that you would be away and that there was this impending crisis in your portfolio?
No, I absolutely have discussed
and you
this
thought it was
matter with the
appropriate that
Minister
both of you would be out of the country or away and allocating someone else to deal with your mess?
Well, there was in fact a very short period of time in which both Minister Park and I were away. Both of us had acting ministers to perform our duties in that time. Other ministers have been actively engaged in this conversation. For example, the Minister for Industrial Relations, the Treasurer. But as I said,
Treasurer also on leave.
I do think that it's reasonable that with all of the work that we did to put contingency plans in place to manage this circumstance, that I took a period of leave with my family in early January. I have young children. I don't
But
wish
those
them to be strangers
contingencies are
to
not
me.
working, Minister, and that is
Well,
what the sector
in
is saying. But I'll
fact-
hand over to my colleague.
I just want to just continue on a little bit in that line of questioning, Minister. Did the Premier talk to you about taking leave, whether it was appropriate at that time? Did you have a discussion with him about it?
I'm not going to go into the private conversations that I had with the Premier, although I will say, of course, I reassured the Premier, as I always do, that when I take a short period of leave from the exercise of my ministerial duties, that I have plans in place to ensure that the work
Sure.
that
So
I'm
what
working
what were the
on-
plans in place when you went in January then, knowing that this was, an impending mass resignation? Who was acting for you? What did you tell them? What did you put in place? What work did you do?
Well, so Minister Harrison was acting for me during my period of absence, and so obviously we briefed her in terms of the development of the contingency plans, if indeed the mass resignation did occur.
So sorry, if you briefed her to say if they did occur, are you saying when you went on leave, you actually didn't know what the outcome was going to be, but you
Well,
still went
that's-
on holidays?
That's accurate because, as
Right.
you can see, Ms Mitchell, at its peak, we thought potentially and had plans in place to manage 206 psychiatrists submitting a resignation letter on a single day.
Yeah.
And so we had plans in place to manage that. That's not what occurred. As you can see from the description that we've already given, in fact, now here we are mid-March and 62, and that number
But
was
when
not
you went away,
62
Minister,
to
you
start
didn't know
with.
that. It could have been 200 the day you came back from holidays.
Well, as I said, we had plans in place, and your question was, what did you do to ensure that the people that were acting in my portfolio, and in fact Minister Park, who was not acting for me but obviously was involved in his...
When both ministers aren't there, it doesn't
We
send a great message.
we had already developed the full suite of contingency plans. That work was underway by New South Wales Health. I briefed my colleagues on that. I was being regularly updated on that.
Okay, so while you were away, were you being updated?
Yes, I was receiving updates while I was away.
What kind of updates did you get while you were on leave?
I received information about how the development of the contingency plans was proceeding to give me confidence that work was well underway, which it was. I was also receiving updates about any potential opportunities that may present themselves for a direct engagement with ASMOF and the college to try and avert this situation. That opportunity did present itself in mid-January, not in early January. I suspect many of the representatives from those organisations were also away, although I don't know, I don't want to comment on that, but that opportunity didn't present itself in early January, but it did present itself in mid-January. I was being briefed on that, and that's when, as also I have discussed previously, I made the decision to come back from leave because I was being briefed on the potential that there may be some scope for an engagement to avert the situation that we are in. I made myself available for that. I mean, unfortunately, that we were unable to avert, partly because we met once again and the government reiterated its position once again about the full suite of things that we were willing to do to try and make sure that our staff specialists remained engaged with New South Wales Health. And once again, we were met with, it's a 25% wage determination or nothing. And so...
Which you've publicly said, I think, in the media, is that that's unreasonable. That's correct, right?
It is
I just want to go to, I guess, some of the specifics around, again, some other commentary in relation to, I guess, managing this issue. And I would have, hope you would appreciate, and the officials with you, we understand that these are serious issues. We don't want people to think that they can't get good mental health care in the state, and so they're not questions that we ask lightly. But you have made some comments, Minister, about doing a system redesign, bringing in nurses to manage healthcare, psychologists, OTs, social workers. Do you think that messaging that effectively, and they are trained professionals, but it is not within their scope of practice to do the same job as a psychiatrist, surely you can see that it's a bit problematic to tell people that others will be able to step in and fill that gap in the same way? That's not actually accurate, is it, Minister?
Well, no, that's not an accurate description of what I said.
Well, but you have. You've talked about having to do system redesign,
Yes.
not just involving nurses, but general practitioners, peer workers, 2,000 health professionals, including OTs and social workers, to oversee case management and therapy. That's all been in the media. So you haven't talked about others taking on additional roles
No,
if
I mean,
you
Kate,
do have concerns?
No, because
You haven't said that at any point.
what I have said, your suggestion to me is that my description there of the opportunities presented by system redesign, and I actually note today in the newspaper, the Coalition of Nine Peaks representing nurses out there saying publicly, we think we should have an increased scope of practice. And not only
Minister,
do we...
you've also got the Nurses and Midwives Association saying publicly, and this is a direct quote, "It is completely unacceptable and ludicrous that the government expects nurses to step in and fill the gaps in the wake of the psychiatrist resignations."
You know, as I said, well,
So
you're conflating
It's your messaging
a
with
description
respect.
of system redesign, which does include the potential for example, nurses to work to their full scope of practice. Again, reported in the paper today, a third of nurses in
That's
Australia
not what I'm
rarely
asking
work
about,
to their
Minister.
full
When
scope
this
of
was
practice.
happening and you were getting media pressure and questions about how will you manage, you very publicly talked about other health professionals stepping in and taking roles in therapy. It's like it's very publicly reported. So you're saying you didn't say that?
That's right. I am.
You didn't say that, ever.
You're verbalizing me to suggest that I used language like step in and take on the role of psychiatrists. I never said that, and you will not find that on the record. I absolutely did talk about the opportunity for broader system redesign, practitioners working to their full scope of practice, which, as I said, I stand by and in fact endorsed yet again today that is not occurring. But not only did the nurses come out today and say that they're not working to their full scope of practice, they are talking about having an increased scope of practice. They are.
Yeah, but
they are talking about that. Now that's not
fine,
me.
but that's not, if that's in the future, great. And no one's disputing that there are amazing nurses who can be doing more if they want to, and that's obviously a matter for them in what they're working through. But my concern is a lot of the public messaging that was being reported at the time was that don't worry, there's others that will manage it. You talk about system redesign, you talk about
system redesign,
about peer work, but you're doing that because you've got a mass resignation of psychiatrists.
No, I'm doing that
the
because
concern is then the sentiment is there will be substandard care for people in this state.
Well, as I said, I mean, I feel as though you are either deliberately or ignorantly mischaracterising what I have said. Right. I never talked about other professions performing the role of psychiatrists. I recognise that psychiatrists play an incredibly valuable role as highly trained specialists in the system. That has been reiterated constantly by myself, by Ms. Pearce, by Dr. Wright. We have constantly said we value and acknowledge the role of psychiatrists in the system. That is why we put the contingencies in place to manage their absence. That is why we have made an effort to transfer many to VMO roles so that they remain active participants in the public health system. But I think that the mental health sector is capable of understanding that, yes, that issue of the resolution of the industrial dispute that we're having with psychiatrists can competently sit alongside a broader conversation about how care is delivered broadly in mental health and whether or not there is increased scope for other forms of care through peer workers or psychologists or social workers can and should be part of that. In my view, having talked to sector stakeholders, is that they welcome that conversation and they're capable of having that alongside a conversation about resolving the industrial matters with the psychiatrists.
Okay, I might come back to that a bit later. I just want to move to a different issue now, Minister, in relation to your North Coast responsibilities. Obviously, we're delayed a week because you needed to be doing your role as Minister, particularly in relation to some of the impacts of the ex-tropical cyclone Alfred. I'm just wondering if you can tell us, I guess, since the end of last week, what you've been doing in your role as Minister for North Coast in relation to that issue.
Sure, and I do also want to thank the committee for the rescheduling. So since last Friday, I have been doing a couple of things. I should say I went up to the North Coast on Sunday.
Where did you go specifically?
Where did I travel? Yep,
Yes.
so to Lismore,
Yep.
to Mullumbimby, to Murwillumbah, to Tweed. I think they were the 4 places that I went when I was there. But I've also been in regular contact with the mayors of those places, but also Ballina and Byron, which I didn't visit during my trip, although I know Minister Scully has been there.
Thank you. And what about Clarence, Minister? You know that they have arguably been impacted the most.
Yeah.
You didn't go there?
No, I didn't get down to Clarence.
Spoken
when
to
I
the
was
local
there.
member from Clarence at all?
Yeah, I did. I have been in touch with Richie.
Really?
I sent him a message just to check in with him early on in the event.
Can you take on notice when that was, if you don't mind?
Sure.
Thank you. Sorry. Yep. So, what did you do when you were there on the ground? Were you
did I
there
do?
for the day, or how long were you there?
No,
for?
I was there for a few days. I visited the evacuation centre at SCU Lismore. I visited the Emergency Operations Centre, which is also at SCU Lismore. I visited the Mullumbimby Safe Haven. I visited the Mullumbimby Neighbourhood Centre, which was very involved in supporting the Mullumbimby Evacuation Centre. I visited the Murwillumbah Evacuation Centre. I met with Tweed Council. I visited the SES headquarters in Lismore and in Tweed. I think that's probably...
I accept that that's quite a few visits. That
Yeah,
you did
as I
while you
said,
were there. But so fair to say you've taken, I mean, obviously there's operational responsibilities that fall with other ministers, but it's a role that you're obviously taking quite seriously as North Coast Minister to be an advocate for that community.
Yes, I try to. I did a radio interview when I was on the North Coast with some Grafton Radio, and they also pointed out that, you know, they were feeling under the pump with this weather event.
Yeah.
And so, you know, I mean, I am aware and I am engaged in that conversation around the Clarence and
Well, that's
Richmond
good, because that's
valleys.
actually what I wanted to take you to. Obviously, there's been announcements for hardship payments for a number of communities and LGAs, but there are many impacted communities, particularly in the Clarence and Richmond valleys, places like Coracai, Broadwater, Woodburn, areas around Grafton and Maclean, and there are many others, that's not an exhaustive list, who have been heavily impacted but have not had that disaster recovery payment extended to them. Why is that, Minister?
I mean, I have to say my understanding of the personal hardship grants that the New South Wales government was funding alongside the Commonwealth is that it did extend to all of the LGAs, in fact down to Armidale, but I will take on notice if my understanding is
it didn't
incorrect.
include the Clarence, and Richie Williamson, as the local member, has been quite vocal in his support for his communities. You may not be aware, but the Federal Emergency Minister, Jenny McAllister, actually reached out to Richie and said, we are happy to look at support for your impacted communities, but the state government has not provided us the data yet. Why is that the case?
Oh, look, I mean, I have to say, I'll follow that up with Minister Dibb. I'm not familiar with
So
the
you
fact
didn't
that
know that was
data-
an issue that areas had missed out on payments?
Well, as I said, my understanding is that the LGAs that were covered by those personal hardship grants did extend all the way down to Armidale, but as I said,
the problem is, Minister, you've missed communities. So there's select towns within the Clarence LGA, but there are many others that didn't. And like I said, that list that I read out was not exhaustive. There are other communities who have been impacted but are not getting the support, and that is a problem.
Yeah, I mean, I accept it's a problem. I'm not trying to argue that. My understanding is that the provision of that support is by LGA, and so my understanding is that the LGAs to which you were referring are included, and in fact all of the LGAs in the North Coast, Northern Rivers and down to Armidale are included. So I'm not familiar with this issue that you've raised about different towns
Richie
within,
Williamson
but
as the local
yeah,
member.
no, of course, I'm sure.
You
And
would take
I
that
have to say, I'm
his
not
word.
familiar. I have not been informed that part of the barrier potentially to the provision of that support is that data from the state is required. It may be, Ms. Mitchell, that data is the SES impact assessment work that they are currently undertaking. I don't know. It may be that is what needs to occur, and all I can say, if indeed that is the case, that the SES is working very diligently to do that work right now, and that will be available. But I don't know. I'll take on notice what that data gap might be.
So just so I can be clear, and obviously there's members of the community that would like that certainty, you're now aware that this is an issue that some communities have missed out, and you're happy to take that away as Minister for the North Coast to advocate to see them get the support that they need.
Yes.
Thank you, that's great. I've only got 30 seconds left, so I might... Oh, just one other one, I guess, in the same vein. There's also some concern from primary producers in that area that they haven't been made eligible for any payments, and obviously there's quite a bit of impact to them. What will you be doing to ensure that
yes,
our
I am
primary
familiar.
producers get support?
I am familiar with that, and full credit to Jeff Provis, the member for Tweed, who
100% for the Tweed. He does a very great job,
Who
Jeff.
did put that issue on my agenda when I met with him in the Tweed. And the commitment that we've given is that we will work through that. I know that the Farmers Federation has also raised that. It is just a circumstance, Ms Mitchell, of needing to work through the various stages of support. So the sole traders, the small business people, there have been grants made available there. Personal hardship grants have been made available. But I am aware that primary producers have expressed concern about impacts on their business. And we have taken on working with the Farmers Federation to assess that and to see what support might be able to be made available.
Thanks, Minister.
Thank you. Minister, earlier in response to my questions, you clarified that you don't want to be privatising the mental health care for involuntary patients, but that is still on the table if required. You have previously ruled out actually paying the psychiatrists what they're asking for. So can you clarify to us, it's your preference to privatise involuntary mental health care over paying staff specialist psychiatrists parity with other states?
No, it is my preference to resolve the pay dispute that we are having with psychiatrists in a way that sees them feel valued and as though they are willing to either continue to engage or re-engage with New South Wales Health. That is my preference. I don't think it's reasonable for the way that is to be resolved is for staff specialist psychiatrists, or in fact any group within the public service, to come to government and say, this is our demand, this is our only demand, we will not negotiate on this demand, particularly when the demand is make up 12 years of wage suppression in 12 months, or we will walk away from the system. And if that is how negotiations are to be conducted, not just with staff specialist psychiatrists, but across the public service, we're in dire straits, Dr. Con. That can't be the way that these disputes are resolved.
And can I just clarify, you've asserted just then that the ASMOF and College of Psychiatrists had a singular demand and weren't willing to negotiate. They've been very clear multiple times that they have been negotiating with you for many, many months now. It's your assertion that they're not negotiating?
Well, it's my assertion that in those many meetings that we've had, I feel as though we've put on the table a number of options, pathways, negotiating points to try and resolve the dispute. And it is, Dr. Con, it is my assertion that in those meetings, the Royal College of Psychiatrists and ASMOF have said the only thing that we will accept to resolve this dispute is a 25% wage determination. Now, in a way, I can respect and understand that. That's their position. That doesn't mean that I have to agree to it, because that can't be the way that these issues are managed more broadly. They're not obligated to put other options on the table. They're not obligated to step down from that or find other pathways forward. But when they don't do that, and it is my assertion that they haven't done that, well, we're in a position of being left saying, we can't agree to this thing that you've demanded. We've put all these other options forward. We're at a stalemate. We're not in agreement. We need to break this deadlock. we're going to use the independent umpire for that purpose. That's what it's there for.
Minister, there's been lots of discourse already about the impact of resignations on patients and their families, but I'm also particularly interested in the impact of both the resignations and the transfer of staff specialist psychiatrists into VMO roles or locum roles on more junior doctors, and particularly psychiatric registrars, doctors who are training to become specialist psychiatrists. What work have you done to ensure that their training can actually continue and that they're safely supervised?
Yeah, I think that is a fair question. Well, we have a very clear line of sight on that issue. So the work that we've done is we have met with not just the college and ASMOF who've raised that issue, but also representative groups of trainee psychiatrists themselves who have raised those issues with New South Wales Health and my office in relation to their concerns. So we've listened to them. As part of our contingency plans, we have put in place efforts to try and ensure that supervision and the oversight of those trainee psychiatrists can continue. In some areas, that's more straightforward than others. To be honest, it's a sort of hospital by hospital situation where, you know, in some hospitals, that's been relatively straightforward to manage. In others, it has been more difficult. But we have been very clear that we do recognise that is part of the challenge that has been presented, and put in place measures to try and ensure that supervision and that support can continue.
I appreciate that you're aware of the issue. You've said that efforts were put in place to ensure supervision can continue. What were those efforts? What have you actually done?
Does Dr. Wright, do you want to talk about some of the things that have been done to try and ensure that supervision can continue?
Certainly. Look, I think that the point I'd make at the beginning is that the provision of supervision for junior medical officers, including registrars, is precisely the same as supervision of any staff. And so the contingencies that we've been talking about, and I know you're aware of the range of contingencies, they're all directed at ensuring maintenance of safe care. And part of that is the provision of supervision. And I'm sure you appreciate if the junior staff don't have access to a senior supervisor, that can potentially jeopardise the safe care. So the supervision and safe care are not mutually exclusive. And the contingencies have been entirely directed towards trying to make sure that even in the event of a depletion of psychiatry numbers, we have access to the care, and that includes the access to the supervision. And so that means, and this is where we come back to the conversation about rearranging the responsibilities of the psychiatrist so that supervision and review of clinical care are right up the top of their responsibilities, and looking for ways to reduce some of the other responsibilities that have accumulated to psychiatrists that can actually be done within scope by other practitioners. And so the safe care and supervision, in my opinion, are right up the top, and they're of equal importance. Now, it is a dynamic situation, and there are challenges in some of our services, and the other thing that we've done is that by creation of a mental health emergency operations centre within the ministry, we have a daily review of the performance in all of our districts, the performance in our emergency departments, the numbers of patients, how long it's taking for them to be seen. We are also monitoring any reports of incidents, and we are very responsive to any concerns that get escalated within the services by anybody, including the registrars or other staff, about whether the contingencies are sufficiently meeting their needs. And we have to respond to those, and we have to adapt on the run. And
so
that's what we've been
in
doing.
areas where staff specialists, psychiatrists who were primarily responsible for supervision of a registrar have resigned, and they've either left or been re-engaged as a VMO or a locum. So they're now on for example, a part-time arrangement or an ad hoc arrangement. Is it your view that it's sufficient for registrars to be supervised by a different person each shift or each week? And how are you actually ensuring that they have a long-term relationship with a senior staff member?
Well, for starts, I think that we've been very clear from the outset that if someone has been working as, for instance, a 0.6 FTE staff specialist, we are very comfortable with that person coming back as a 0.6 VMO. And so the idea that that person is not available to provide the supervision, that's not true. So for those psychiatrists, and I'm so grateful to those psychiatrists who feel strongly about this issue and have returned as a VMO to help support our system, there should be no disruption in the continuity of supervision. And when that does occur, and we do have to cobble together cover and supervision from a range of psychiatrists, if that causes concerns about the quality of the supervision, then of course we respond to that. But when we lose fractional...
So specifically, Dr. Wright, what does that responding to those concerns look like? As I'm sure you can appreciate, those concerns have been raised with me. That's why I'm asking the question.
Well, okay, I'll give you the example. So there were concerns raised in Sydney LHD a couple of weeks ago, and the service general manager sat down with representatives of trainees and went through what the concerns were and dealt with them one by one. And that's the response. So it's at a local level.
And dealt with them in what way? What was the resolution to the issue in Sydney?
Well, my understanding is they dealt with them to the satisfaction of everybody.
I mean, so for example, I mean, look, we can potentially take on notice some of the specifics, but for example, you know, when you look at the as you know, Dr. Con, when you look at the supervision requirements, they're actually incredibly detailed. You know, two practitioners on at this time, and you know, this many hours. It's incredibly detailed requirements, as it should be. And so what Dr. Wright is saying is that there's a huddle where they sit down and they talk through every single element. And say, how can we do this better and differently, or improve that, or meet requirements on that, and that is in fact what has been happening. So, I mean, if there are particular circumstances where at a district level or at a hospital level you have received information that hasn't occurred, or that you're worried about gaps there, we're happy to take that on notice. I don't think we necessarily have every single line of issues that may have arisen and how they've been resolved at our fingertips, but we're happy to get that information for you.
Thanks, Minister. Look, I'll come back to it this afternoon, but I'm sure you would be concerned to hear that registrars are also now considering and are leaving New South Wales.
Yes, of course I'm concerned. I'm concerned about the psychiatrist situation. As I said, I take it very seriously.
I'll go to Ms. Fairman.
Thank you, Chair. Minister, I just wanted to go back to our previous line of questioning around the long-term average annual extraction limit, plus other volumetric limits in the water sharing plans. So you said that they weren't in there originally. I think Ms. Jones confirmed that.
Well, I think that there was a description. There was a description of numeric limits.
That was in the unreg plans,
Yeah.
Minister,
No.
yes. But if you're referring to about 5 years ago, the LTALs are not a volumetric limit. They're not a set number. The LTAL is a moving measure of the impact of water extraction over time. So it's model-to-model comparison, and obviously with every weather event in each year, the volumes of water available changes. So what we're doing is measuring over time a model-to-model comparison, a point-in-time model to current conditions, and we're making sure that water is taken within a range. So the LTAL itself is not a volume.
So, Minister, the LTAL...
It was removed. They were removed from regulated river water sharing plans about 5 years ago, in response to stakeholder feedback that it was confusing, Parliamentary Council's advice that it made the water sharing plans complex and we should change that drafting. And NRC, you're correct, are looking as to to move to sustainable diversion limits, which is what the Minister referenced is the work that we're progressing.
So the calculation of long-term annual average extraction limit, so this is includes the water storages and water use development that existed in 1999-2000, plus the level of development for plantation forestry that existed on 1st of July 2009, and the maximum crop area and the crop planting behaviour for the Murray-Darling Basin cap, that's 1st of July 1994, that's correct?
Well, the model, the baseline model for comparison is
the question was the long-term annual
1999,
average
yeah.
extraction limit, what I just read out, Ms Jones, that's correct, isn't it?
So, yes, for some catchments that
so,
would be correct.
Minister, is there any monitoring of water storages or the level of development or the cropping area, for example, on an annual basis?
Absolutely. So that's the other
Minister?
model that it compares to. It's the current conditions model, which includes all of the most relevant data from each water year, so that it's a long-term measure. So where we have a baseline model,
So
and
the
then we
question
compare
I'm
that
asking
model
is there's
to
the long-term,
conditions.
excuse me, Ms Jones, the
Yeah.
question I'm asking is there's the long-term annual average extraction limit, right? It's a limit. It doesn't shift and wax and
No, it
wane.
does.
It's a
It
limit.
changes year to
because
year,
it
and
does,
that's-
it does, Ms
yeah.
Fairman.
So-
Because it is a long-term annual average.
So
So
the
a long-term annual average does change based on climatic conditions.
So the question is, for example, with in Guida, Namoy, Macquarie, places like that, where the maximum crop area in the baseline diversion limits, for example, increased by 50%, right, compared to the maximum crop area under the Murray-Darling Basin Plan. So how is things like that possible? It just seems as though the limits are increasing and increasing and increasing, doesn't
So the maximum crop
it?
area is a reference to how floodplain harvesting licences are calculated. So that's a really specific subset of water abstraction in particular catchments. I think the important thing about the long-term extraction limits is that it is that average over time. So we do take the baseline of a line in the sand historic 1999 to 2000 set of conditions, and every year we add to that information with the current conditions model, and it's the comparison between those two models that gives us the long-term average. And what we need to make sure is that the overs and unders of that modelled outcome are not exceeded.
And to be fair, Ms Fairman, I accept that answer, which is a description of the way that we currently manage some of our decisions around extraction, does have quite a lot of scope to go up and down. That is why the dissatisfaction you may have with that answer is why moving towards sustainable diversion limits is so important, because that limit, that decision around what is sustainable from as a diversion and a limit on that is a very important principle. And yes, it is a source of frustration to me, as I'm sure it is to you, that we do not have that for all of those plans yet. But that's the commitment that I've given, that work is being done and is a priority. And we are deprioritising other work to ensure that can happen.
Thank you, Minister. So in terms of the Natural Resources Commission's so the final report, review into the water sharing plan, the Murrumbidgee regulated river source, the plan amendment recommendations from the NRC in relation to the long-term annual average extraction limit states that clause 16 of the previous plan, which is the LTAL, notes that the plan, that it doesn't have it in this plan, and that stakeholders have called for inclusion to increase transparency.
Yeah, so I think we
which
will...
seems to be contrary to what you just said, Ms Jones, that stakeholders wanted it out.
I think there's different views from different stakeholders.
Exactly, thank you very much. Which stakeholders were you just representing, Ms Jones, when you said that? Big irrigators potentially?
I
Well,
can't specify
that's what you
which,
said.
but it was 5 years ago.
That's right. So
under the previous government,
also, just to be clear, before Ms Jones was
Sure.
in charge of the water
But
board.
I think
so
it's
I
important.
don't think it's fair to pin us for decisions made 5 years ago. My understanding, Ms. Fairman, is that yes, what Ms. Jones and you have described did occur. That those figures were still in the plan potentially as a note, is my understanding. So they were not removed entirely. But yes, the changes that you have described did occur. But I'm also happy to indicate our view is that for the purposes of transparency, as you note, that they will go back in. So there is no fundamental disagreement from myself as the Minister and Ms Jones as a witness to the proposition that you were putting forward. But I do want to indicate once again that the primary piece of work is SDL's clear across the board.
So another question then, just to kind of illustrate what's happening. There was a research research piece that was released just in April by ANU scientists, which looked at, this is in Journal of Hydrology, peer-reviewed, effects of long-term trends on stream flow in the Murray-Darling Basin by Long Chu and others. It has said that about half of the decreased flows in the northern Murray-Darling Basin this decade is due to increased extractions. I'm sure you're aware, Minister, it's the latest body of work that shows that. So what are you doing to address the significant increase in extractions in the northern basin?
Yeah, well, I mean, we are doing the connectivity expert panel, which has specifically looked at exactly the issue that you are referring to, which is why our rivers and streams are struggling with connectivity and the extent to which over-extraction is a contributing factor to that. So that is one thing that we are doing. We remain committed to implementing that work. We are finalising the modelling on that alongside the NRC and representatives of that expert panel. We have already made decisions. For example, in the Namoy, in relation to extraction, on supplementary licences in particular, that were over what were sustainable extraction limits, to bring them back down. So we are already making decisions in relation to annual water determinations that reflect a more cautious approach.
Thank you.
And we are doing that systematic work to try and ensure...
One more question I'll just get in. Given all that, I am frequently made aware by stakeholders of applications for new work approvals for infrastructure to access floodplain harvesting water. One most quite recently in the Macquarie Valley, an application from Macquarie Agricultural Funds Management for extensive water supply works, channels, pipes, on-farm storages of more than 6 gigalitres. There's quite a few that keep on coming. So how does this get approved? How is it offset? So the thing that we can't just keep the extracting more and more and more water, there has to be a limit. Are these approvals offset somewhere else when they are approved? So that's 6 gigalitres, for example?
So there are two separate approvals here. One is that the flood works in a floodplain need to be approved under a flood management plan, and there are criteria around where works can be approved and where they can't. That's a separate decision too. The limits set for floodplain harvesting don't change. So if the licence limits can't be increased, so even if a work is put in place and it's approved under the floodplain management plan, that doesn't mean the abstraction for floodplain harvested water increases. It doesn't.
May as well not approve it then.
But the works are not always for extraction. Sometimes they're to control volumes and prevent destruction of downstream areas.
I mean, look, Mike, I understand your point you're making, Ms. Fairman. I mean, my view is you may as well not approve it. People are entitled to put in applications to do works on their own land. That doesn't mean they're entitled to use them, and they may not have a licence to actually use water in that work, but it's their own land. If they wish to have a work done on it, but that's a completely separate question to whether or not water is actually being extracted via that work.
Minister, as acknowledged in the government's response to the community mental health inquiry that this committee undertook last year, you acknowledged both the effectiveness and the cost effectiveness of HASI and HASI Plus programs, supported accommodation for people living with mental illness. Will those programs be expanded in the next budget?
I don't intend to answer questions about the next budget, Ms. Dr. Con, excuse me. I'm here to answer questions about the budget that was passed last year, and it isn't common practice in budget estimates to give forewarning about what may be coming in the next budget. I think
that's right. Some of your colleagues sometimes do.
Well,
if I can
nice
squeeze
try,
in
but
one more question.
I'm not going to be signalling upcoming budgetary decisions. Although I agree with you that those are very important programs.
In that same government response, you committed to considering 5-year funding cycles for community managed organisations in mental health. Where's that work up to?
Yeah, absolutely. I mean, that's a commitment that we've given across the board. We have talked about how we might move to that. I mean, health, unfortunately, is really been operating on a lot of 12-month budgetary cycles. So, in some areas we're trying to move towards longer term contracts. Susan, do you have anything to add just in terms of specifically the renegotiation of some of those contracts? No, we'll have to take that on notice.
Thank you. Ms Mitchell.
Minister, just in terms of negotiations with the psychiatrist, you said earlier that sort of nothing apart from the 25% has been put forward from them. That's correct?
Yes.
Okay, so are you aware, or was there an offer in late January to accelerate junior staff specialists to senior staff specialist roles to help with recruitment? Did that come from the psychiatrist?
Yeah, I mean, those kinds of offers were all ways to achieve a 25% wage determination via different methods.
Right. Well, what about they also, I'm told, put forward offers to have the 25% over 2 years, potentially backdated? That was put on the table as part of the negotiations?
Yes.
Right. So there was back and forth. You said before there's no back and forth. It was just a flat amount. But from the information I have, they have come to you with options to government.
I mean, the 12 and a half, the split over 2 years was put on the table at a more
So were you
recent
misleading the
meeting?
committee when you
No.
said that there weren't actually negotiations back and
No.
forth? Because it sounds like they did come to you with some options for government.
No, well, I mean, those options are versions of a 25% wage increase. Now, as I said, that's okay. I mean, yes, you backdate one to 2023 and deliver another now. That's still a 25% wage increase right now. It's just calculated in a different way, but the outcome of all of those options is exactly the same. And I'm in the outcomes game. So I'm not trying to, as I said, I respect the right. I'm a trade unionist. I'm a member of a union myself. I've worked for a union. I respect the right of unions to make a decision about what they think is in the interests of their members and put that on the table and strongly advocate for it. No knocks on them for doing that. But it's not going to be possible for government to accede to those demands in every circumstance. That's not how it works. And in fact, if that were to be the case, that would be quite an untenable position for government to be put in. So, as I said, we feel as though there have been numerous efforts made by government to outline potential paths forward. The position of the psychiatrist has consistently been, and as I said, I respect their right to advocate their position, that they require a substantial wage increase right now. Whether that's done by backdating 12 and a half and delivering another 12 and a half now, whether that's done by regrading within the current award, the outcome of all of that is the same. Ms Mitchell, the outcome of all of that is the same, which is a substantial pay increase right now for psychiatrists, one that it's not tenable for us to agree to, and that's why we've gone to the Commission.
Thanks, Minister.
Are there any questions from the government?
Thanks, Chair. Government members don't have any questions.
Thank you. That being the case, we will break for morning tea now and return at 11:15. Thanks, everyone.
Wednesday last week. Hey mate, rough few days ahead. I know you're in the briefings. Just if you're getting the runaround on something important for your community and want to cut through, always feel free to give me a buzz. And he says, thanks mate, we are prepared for the time being. Appreciate the text and talk soon. So
Thank you.
I did just want to signal that there was a connection with myself and Richie.
Thank you.
But also I reiterate that I understand there are concerns around the Clarence and Richmond Valley and them getting the attention that they need.
Thank you, and I appreciate that clarification. Thanks, Minister. I want to take you now to the Cobar pipeline and the decision to effectively not proceed with that project. Considering the construction of the first 30 kilometres of that Nyngan to Cobar pipeline cost $9 million back in 2017, how do you account for the remaining 90 kilometres now costing more than $300 million?
Yeah, on that project, obviously we're proceeding with stage one. Stage one is fully funded by the New South Wales Government and the Commonwealth Government, that being the pumping stations. They're a very important project. All I can say on stage two is the project isn't cancelled, it's paused. And the reason that it's paused is because a final business case was done. Obviously, I don't write those documents. They're done by expert people who put together that information so that government can make sensible investment decisions. And that document has indicated that the cost of that project has escalated considerably to over $300 million. And at present, we're not in a position to make that kind of investment decision for a project at that scale. I do want to indicate, my understanding is that there are two pipelines that service the Bogan Shire and Cobar. One of them is older, but the other one, which was constructed in the 1980s, has a functional life that extends some decades into the future. So, of course, it was important to me when pausing that project to have that confidence that that pipeline was functional and would continue to be functional, and that is a confidence that I have. But in terms of the cost escalations, all I can say is that's information that was provided to me via the final business case.
Okay, so just on the final business case then, will you publicly release that?
Well, at the moment, has not been finally considered by ERC and therefore is a cabinet in confidence document. But it is always my view to try and ensure that as much information is publicly available as possible. So I have committed to doing what I can to explore how much of that business case we can release without cutting across cabinet in confidence provisions.
Okay, so, but Minister, you've said that that business case informed the decision to, and I'll use your words, pause that project, but you're also now saying you can't release it because it's still with ERC. So how has a decision been made if you haven't been through an ERC process?
Well, I've made a decision in terms of the...
Well, then why can't you just release the business case that informed your decision?
Well, as I've indicated, I am working to try and find how much of that business case we can release, but routinely government does not release final business cases, and I recall this being a source of much contention in many SO52s under the previous government, that business cases were not released. They were always considered cabinet in confidence documents. I've always tried, and it's always been my position, to try and ensure that as much information that can be released is released.
Okay, and will you give that commitment today in relation to this particular project?
That, to the extent that I am able to make decisions about how much information is released, I absolutely give that commitment, but I reiterate, they're not, those decisions in relation to what information is considered cabinet in confidence and therefore capable of being released are not decisions that I make on my own. They are decisions that are informed by the Cabinet Office, that are informed by INSW, which has ownership of some of those business cases.
Okay, but I think for the community's benefit to have some sort of understanding, because as you would appreciate, it's quite an escalation in cost for the first 30 kilometres versus the remaining 90 kilometres. To go from 9 million to 300 million is a significant increase, and I think the community would rightly expect to know exactly what was involved in that cost escalation. But I appreciate what you've said about a business case, but if you could perhaps maybe take on notice what you can supply to the committee,
I
that
will
would be
do
great.
that.
Thank you. What you seem to indicate that this is a project that isn't, it's sort of not now, I guess, from what you said in terms of funding constraints. What is the time frame for it being back on the table as a reasonable project from the government?
We don't have a time frame at present. It is paused. I'm not being coy. I genuinely don't have a time frame. We don't have a time frame.
So then how can you say it's only paused if you don't have a time frame for delivery? Isn't it off the table?
No. There is value in the project. We've done a business case for the project. Under current circumstances, both in terms of the existing life of the pipeline and the economic circumstances of the state, do not warrant an investment decision of that scale at this time. That does not mean that will not be warranted in the future. I can't give you a time frame as to when that investment decision will be made. It is a big investment decision. It is one that will require ERC to approve when it is viewed necessary, and I can't be in a position of being definitive about when that will occur.
Have you had any concerns raised with you? I know that the Mayor of Cobar Shire has done some sort of media or spoken to the media about particularly, I guess, some of the implications with the Endeavour mine, which is scheduled to come back online in May, and the decision around the pipeline, what that might mean. Are you aware of those concerns, and is there anything that you're doing in relation to that?
I am aware of those concerns. My advice is that the current stage 1 of the project and the existing capacity that is there is sufficient to meet community demand, including the demand of the mining sector. I would just use this opportunity to say this, which is my understanding is that the mining community, which is a really important part of the community out there in Cobar, is a significant beneficiary of these projects, a significant beneficiary of these investments. And we want to support that community, and we want them to have access to the infrastructure that they need. But in a circumstance where the mining industry is a significant beneficiary, we of course approached them to discuss the potential of co-contributions or other support in an environment where I'm being very upfront. The size of the investment decision is a challenge for government, and that was not forthcoming. So that did make it more difficult for us to proceed. But yes, I am aware of those concerns. And as I said, my advice is that our current capacity is sufficient to meet that demand.
Okay. You just talked about the size of investments. On the same day, the Friday, the 21st of February, that the Cobar pipeline project was put on hold, it was reported in the Macarthur Chronicle that Water New South Wales were investing $301 million on Warragamba Dam upgrades for environmental flows. Is there a business case for that project?
I'm going to ask Andrew from Water New South Wales to talk about that project.
Thanks, Minister.
Yes, there is. There's a strategic business case that has been put to Infrastructure New South Wales under the investor framework.
Okay, and is there any, or are there any, I should say, publicly available documents detailing the proposal? We haven't been able to find any, but if there are...
Yes, so there was detailed information provided as part of our pricing submission to IPART recently last year, and that information is available on IPART's website.
Okay, is there anything on the Water New South Wales or planning websites about it though?
No, not at this stage.
Okay, could you maybe take on notice and just provide any of those documents to us that you're able to in terms of what's been in the public domain about that particular business case?
Yeah, absolutely. Happy to provide that.
Thank you. Minister, I'll just come back to you. Last year, the end of 3rd of December it was, you were talking about the new PFAS filtration plant in the Blue Mountains, and you quoted on the ABC of saying, and I quote, "There's no price you can put on making sure we have the most rigorous treatment in place," end quote. Given that you're obviously making commitments in the Blue Mountains, will you also commit to funding a treatment plant at Warrialda, which the Guarda Shire Council say will cost more than $1 million?
no, not at this stage, because I've met with the Guida Shire Council, and in fact the request that they made to me was not for a new treatment plant, it was for the opportunity to drop a new bore.
Right.
And we did commit to them to not only fast track the application for that work, but also to provide financial support to do that. So the reason that I'm not committing to that is because when I met with them, they didn't raise that with me.
Okay.
They talked to me about dropping a new bore, and we're happy
that's
to work
great
with them.
news.
Yeah,
in
and I
order-
might come back this afternoon with some more specific questions to Ms Jones in relation to that. Okay, thank you, Minister. I just want to turn back to your North Coast portfolio quickly. Are you able to tell me exactly which LGAs you cover as the Minister for the North Coast? Where's your remit?
Yeah, so it is, I think there are 11 LGAs, and it is going to test me to list them all.
That's
off
right.
the
Do you want
top
to
of
just
my
provide it
head.
on notice? I'm happy.
Yes,
if you-
but it does go, I can tell you, from Port Macquarie to the border.
Okay,
And there
fantastic.
are 11 LGAs within that area.
Great. And you'd obviously be aware, I would assume, that regional crime is a massive issue, including in the North Coast. How many meetings have you had in relation to crime in LGAs, specifically in your portfolio area, since you became Minister?
Oh, look, I can't put a number on that. I'm happy to try and take it on notice. I accept that when I meet with particularly local government representatives from those LGAs, which I do individually and through various peak forums such as country mayors or local government New South Wales or regional cities, that they do raise the issue of regional crime.
What about Kempsey? Has anyone spoken to you or met with you about the crime issues in Kempsey? Have you sought a briefing, looked at any of the data in relation to the escalation of issues there?
I have met on a number of occasions with Kempsey Shire Council, and they have used that opportunity to raise those issues with me. They've also raised a number of water issues with me.
Okay. Are you concerned about the escalation of crime, particularly in North Coast communities that you represent as Minister?
Of course I am.
And what are you doing proactively to support those communities as they grapple with this crisis?
Well, my role as Minister for the North Coast, as I think we've discussed before, is primarily as an advocate within government, and I do take the opportunity to ensure that the lead ministers in relation to crime, being the Police Minister, the Attorney General, the Minister for Youth Justice and others, are aware of the extent to which these issues are present in those communities, and I am confident that they are, and supportive of them in the decisions that they have taken to try and respond to that, whether it's in relation to community investment, whether it's in relation to bail reform. I think it's clear from the decisions that the government has made, both legislatively and at a community level, that we have heard those concerns and we do take them seriously.
Okay. Minister, the Premier has made some comments in recent days in relation to the issues of squatters in Lismore in particular, and said that he, I'm paraphrasing a little, but effectively wasn't aware of the extent of the issue until he was there recently. When were you first made aware of the issue with squatters in Lismore?
I can't remember exactly when I was, but I was aware of those issues.
For the last week, month, 6 months?
The last few months.
Okay. And have you raised that with the Premier at all?
Look, I haven't had a personal conversation with the Premier about that issue, no.
Right, but isn't your role, you just said your role is to advocate with other ministers about issues. Clearly there's concerns in the community about what is happening there from all sides, and I appreciate that. But you've known about it, you say, you think for at least a few months, but you can't quite remember, but you never raised it with the Premier at all? It took him going up there to see it.
Look, I don't want to comment on the Premier's schedule, but I'm aware of it. I've talked to Minister Scully about it on a number of occasions, him being the minister that's responsible for the Reconstruction Authority. We've worked together through the Reconstruction Authority and Homes New South Wales to try and engage with that community and resolve their housing needs. I mean, I don't perform the job as Minister for the North Coast by every time I have a meeting with another minister, a portfolio minister, about an issue on the North Coast, subsequently calling the Premier and filling him in. I think that would be...
Isn't that kind of your job as Minister for North Coast?
I don't think it is my job to call the... I mean, I'm having those conversations regularly. I don't think it is my job to call the Premier 2 or 3 times a week and let him know. Just FYI, I've just had a conversation with Minister Scully, Homes New South Wales, and the reconstruction of work. I'm doing that with the lead ministers. I don't call the Premier every time I have a conversation with a colleague about a matter on the North Coast. I don't.
Minister, you're actually the Minister for Homelessness and the Minister for Housing, so you are the Minister responsible from the beginning to the end. You said you've known for several months that there were people who were homeless, that were living in these properties, and yet you did nothing. And you didn't think to forewarn the Premier ahead of the floods that there could be people in danger.
Well, none of that is accurate. I have been working on having Homes New South Wales engage with the Reconstruction Authority for some time to try and resolve this issue, including specifically conversations between Minister Scully, Minister Dibb and myself in the lead up to TC Alfred about the presence of squatters in the Pine Street community and ensuring that the SES and others were aware of that as they managed evacuation orders. The only thing that I haven't done that you seem to suggest that I should do is every single time I do something in my portfolio with another
Minister,
portfolio
I'm not
minister,
suggesting that.
call
This
the
was a
that
pretty
is the
serious
suggestion,
issue about
'cause I've
squatters,
worked
so
on it.
much that the Premier went up there and said, right, we've got to do something about this, it's not good enough. Like, he has come out on it and said, we need to do something on this straight away. But you're saying to us, oh, you didn't think that was worth picking up the phone and saying this is an issue. That's my question to you.
I did pick up the phone and have been working on it with Minister Scully for some time.
But Minister, you implied through the media that these people have not been engaged with homelessness services, but you're now saying that for the last several months you've been aware.
I'm sorry, I missed the question.
Sorry, I need to hear the point of order. Thank you.
So on two sequential occasions, 3 in fact, 2 and 1, the members make political assertions instead of asking questions. I thought the whole point of this was to ask questions of the minister so she can answer the questions rather than make political points.
Well, Chair, we're allowed, to the point of order, we're
want
able to put
questions.
context to our questions, and I don't think that that's outside of
To the point of order, I mean, questions are not meant to include argument, but also the Minister is able to answer the questions as she sees fit, and the Minister has chosen to answer those questions.
Apologies, Mr McLaren-Jones. Was your suggestion that I had implied in the media?
It was a quote saying that these people had not been engaged with homelessness services.
I am happy to clarify, we have made numerous attempts to engage these people with our services. They have declined those efforts, which I think is unfortunate, but I have been aware of this issue for some time. I have ensured that as the Reconstruction Authority manages their properties and the decisions that they are making around what to do with them, that to the extent that there are people who require housing and homelessness services, we have been very proactive in physically going door to door to try and engage with people and reach out with them.
Thanks,
but
Minister.
at present, those individuals are declining our assistance.
Okay, thank you. I want to take you to the youth portfolio. I've asked you many estimates about what's happening with Regional Youth Task Force. Obviously that has been disbanded. You've said to us a lot that you're looking at a new option around youth, a new agency, I believe. We are now past the halfway mark of this term of government. Can you now tell us, where is that up to? What will the new youth agency look like? Who will be the responsible secretary? And what have young people told you about the way forward?
So we are finalising the structure of that new office. We intend to have it in place by the middle of this year. We have done incredibly deep engagement with young people.
Yeah, what are they saying to you about that?
They have said that they want to speak on their own behalf, to have more opportunities to speak on their own behalf within government about the issues that are important to them. And we are trying to reflect that feedback in the structure of
Where's it going to sit in a sort of organisational sense? Who will be the responsible secretary for that agency?
Yeah, so it's going to sit within the Department of Communities and Justice.
Okay, and that's been confirmed, yes?
Yes.
Okay. And then in terms of how you'll have the interplay, I guess, with the Advocate for Children and Young People, how will that work?
Well, I mean, that is being finalised, but it is my intention that the Advocate for Children and Young People in the office will be an integral part and have a leadership role within the office. But exactly that structure.
So will they keep their sort of autonomy that they have now, that office?
So yeah, we in terms of the legislative provisions around the advocate for the role of the Advocate for Children and Young People, it isn't intended that will change.
Okay, thank you. And then, I know that the advocate's in the room, and I don't mean to make her feel, but her term is finishing, so it's a fair assessment just to ask, what is the process for the appointment of a new advocate, and when will that start?
Yeah, I haven't turned my mind to that. The current advocate is doing an outstanding job, doesn't finish up until the end of the year, is being really present in communities, and I don't. Yes, the current advocate is finishing up at the end of the year, but we haven't put in place the measures to organise a replacement yet.
Okay, but it is intended that you will continue to have that role?
Yes.
Okay, thank you.
Yes, absolutely.
Thanks. I think that's my time.
Thank you. I'll go to Ms. Mihalik.
Oh, great, thank you. Thank you, Madam Chair. Thank you. Good morning, Minister. I just want to ask you a couple of questions on behalf of Ms. Helen Dalton. You probably be quite aware of them, but one in particular I want to ask you in relation to obviously IPART's going to come down with their draft determination for the Water Administration Ministerial Corporation prices, and a question was put to you by Ms. Helen Dalton in relation to utilising the powers under Section 13(1)(c) of the IPART Act. I appreciate you yourself can't write to the IPART, but have you had conversations with the Premier to perhaps write a letter?
Yeah, I mean,
similar to the letter that he wrote regarding Sydney Water and Hunter Water.
Well, I mean, I understand that this issue was raised directly with the Premier in his estimates.
Yes.
And, he indicated there, and I have no reason to believe that this is not the case, that he is open to that. He is open to using that provision.
Similar to the one where he wrote cost of living and other factors. So he's only got a little time left, right? Because the determination is coming out by the end of March. Is
That's
that right?
a draft determination.
Yes, a draft determination. But presumably he'd need to write a letter pretty quickly, right?
Well, I mean, he can write that letter even after the draft determination is released, and in fact, in the process of finalising the determination. Although, as he has indicated, and I will reiterate, IPART already has within its remit
to look
role,
at social impacts.
That's right.
I'm
to
aware
consider
of that.
Yes. And so.
But it does help getting that letter from the
understand.
Premier. Yeah. So, do you support the current Water Administration Ministerial Corporation prices that they've put forward in their proposal?
Look, I understand why the submission has been made in the way that it has. I am very concerned about cost of living impacts, and I await IPART's determination before...
No, but do you back that report? They've put price hikes for Murrumbidgee, everything. North Coast. You're the Minister for North Coast, and right now they've got disaster recovery. You would think, can they cope with these price hikes?
Well, as I indicated, I understand the drivers that have contributed to the submission being made in the way that it is, but I'm not...
Do you support the report? Do you support
the submission?
The submission, yes, the report.
Well, I don't understand what you mean by support.
Well, it's... okay, I'll turn to page 8. It's saying in there, WAMC has secured the New South Wales government support to make this proposal to IPART. So it's saying that it has your support.
To make this proposal to IPART. So
it
has my support.
I'm asking
to
you...
make to make a submission to IPART.
Obviously, that's referring to the substance of the proposal, though, isn't it?
Well, no, that's actually not what that sentence says. It does not say it has the support of the New South Wales government for the substance of this report. It has our support to make a submission to IPART, as it is legislatively required to do. We wait.
So did you raise your concerns about those price hikes then?
Absolutely. I've continued to raise those concerns.
Did you do that in writing? Is there anything that we can see a copy of? Why would you allow that to go into the report to say that the New South Wales government supports it? I don't understand that.
Well, as I have just indicated, Ms. Mihalik,
So
the support
is
for-
just so they can write a
Yes.
report, which they're required to do anyway.
Yes, that's
but it's
right.
not the substance of the report.
No,
None
not
of it,
until
right.
IPART have done their job. And I want to be very careful about cutting across the independent remit of IPART. They have an incredibly important role to play.
Well, hang on. The Premier wrote a letter. He wasn't concerned about writing a letter raising concerns about cost of living for Sydney Water and Hunter Water, so he was happy to cut across. What about North Coast now? You don't think that there should be some special provisions there? I mean, wouldn't there be a matter of urgency to reconsider these price hikes with the North Coast?
Well, I mean, perhaps, although as I've indicated, the current status of that work is it is under consideration by IPART. They will release their draft determination. We will make decisions about what, if any, engagement we have between draft and final determination. And then even after IPART makes its final determination, it remains an option for government to make decisions about how we proceed in those circumstances.
So you'll give a commitment that you may not necessarily agree to these prices down the track. Is that what you're saying?
Yes, absolutely. I'm not making any commitments in relation to our position on those matters until IPART's released its final report.
Okay. Well, you'll respond to Ms Helen Dalton in that way then, when you answer the question? That's great. Thank you.
Minister, the statutory review of the Mental Health Commission was due to be tabled with yourself in August last year. Why has it not yet been made public?
Because we're just finalising our response to it. So I have received a copy of that report. It makes a number of recommendations and we are finalising our response to those recommendations, and they will be made public alongside the report.
When will they be made public?
Look, I hope that that will be able to be done soon, but I can't be definitive, and I'll take on notice whether or not we are able to provide you with a specific date, but that is in its final stages.
Thank you. And similarly, you've previously made a commitment that a summary of the findings and recommendations of the evaluation of the Towards Zero Suicide initiatives would be made publicly available by the end of 2024. Why hasn't that happened?
Dr. Flynn, I have to say, I'm not familiar with.
Thank you, Minister. Excuse me, and thank you, Chair. We have received, so the Ministry has received the evaluation of the Towards Zero Suicide programs, but we have just commissioned and have even more recently received a Sachs Institute international review around community non-clinical suicide prevention initiatives, so we can put both of those two pieces of work together and discuss them with the Minister to inform future investment under Towards Zero Suicide. So we just need to have a chance ourselves to look at the Sachs report, but in a sense our view is that there was an excellent and thorough evaluation done by Taylor Fry, but we did want to add to it, what does the international evidence tell us, which is a different piece of work. So both of those together will be discussed and presented to the Minister as soon as we've received and had a good look through the Sachs Institute findings.
Thank you. Look, the Sachs Institute findings do sound valuable,
yes.
But can you tell us when that will be made publicly available?
I guess it's up to the Minister to decide when it's public, Chair, but from our perspective, we would be ready to provide that information to the Minister within the next 2 to 4 weeks.
And I am happy to indicate, Dr. Conn, that I commit to making that evaluation public as well. I see no interest, or I see no value in not making that information public, particularly because once you're aware it exists, if we don't just proactively release it, the powers of the House will compel its release. We might as well save ourselves the fuss.
You can hear what I'm thinking from here. Well done, Minister. Last year we had extensive discussion about the need for an alternative response to mental health emergencies, and you're on the record agreeing with the findings of this committee in relation to the role of police in mental health emergencies. You also made a commitment at that time to develop a framework for an alternative model for Cabinet's consideration by the end of last year. Where's that work up to?
So the framework is developed. It has not been through Cabinet yet. We are finalising a date for that. It is, a not insignificant piece of work. It does involve obviously not only my portfolio and the contributions of the mental health branch, but also Minister Park in particular through ambulance engagement, and also Minister Catley. So we are finalising a date to proceed, to the next stage of that important piece of work. I think Ms. Pearce was letting me know recently that she is meeting with the police commissioner about that. So that engagement and that piece of work is ongoing, and is coming to the point where we're taking that next step, which I should indicate to you, Dr. Con, will involve more comprehensive community consultation, because whilst we have been engaged in interagency conversations, which were necessary because, mental health branch and ambulance and police and that all needed to come to the table, I accept that we have not engaged with our stakeholders and our community and people with lived experience and their loved ones, and that does need to happen. And so that is part of the next step on that work.
Okay, thank you. I'd like to move on to the youth portfolio. Just in following on the earlier questions from the opposition, you've made it clear that it's not your intention to change the role or the legislative framework around the role of the advocate. Is it your intention to change the structure or the resourcing of the office?
Well, the structure potentially, so resourcing no, but it may be that in the creation of this more central office or agency, that some of the structure of the office may change. But that change, which we're currently working through, and does involve industrial discussions with public servants and their union representatives, and we want to make sure that that's done in a proper consultative way. Would only be intended to strengthen and elevate that work.
In particular, I wanted to note the special inquiry into children and young people in alternative care arrangements with the Office of the Advocate undertook, which was the first inquiry under that provision of the Act. I'm sure you would agree that it was an extraordinary piece of work. It obviously led to a change in government policy and will significantly impact young people. What was the level of resourcing required to enable that kind of independent special inquiry to take place?
I might ask the advocate to comment on that. I'm not aware of any requests that came through me for specialist resourcing, although I was aware. The advocate, of course, did inform me that she had been working with Minister Washington, in relation to the development of that inquiry. So, and I was extremely supportive of it. But did you maybe want to comment about that, Zoe?
I'm happy to talk about the funding that was attached to it, and we specifically did not request funding from the government because we wanted it to remain independent and always have the perception of being independent. So that was a conscious decision of the office to ensure that. The total cost in relation to the special inquiry was $132,000. That doesn't include the in-kind that was given to us through a consulting firm, Deloitte, who provided contributions. A majority of that cost, as you would appreciate, had things to do with ensuring we had a co-chair who was a young person with lived experience, so they received payment for their participation in that. We also had a social worker that sat alongside that, and I can give the full breakdown of these numbers as well. A social worker who sat alongside that and travelled to every inquiry meeting so that they had that support in those meetings. Travel attached to it. We also had to make sure that we were doing things in line with the Act in terms of giving notice, and there was a requirement to advertise in papers and all of that, so that costs some money. And then we also had a law firm who sat alongside it and a special counsel who reviewed every transcript to make sure that none of the questions were leading, that we did all of the things that we said that we could do so that they could provide kind of an audit over the whole process to say we did all of the things that we said we could do. And in terms of team, what it was that we had to just reprioritise some of the work that the team were focusing on. So myself and a senior policy advisor were the key people in terms of running all of the interviews with the young people, and we drafted the final report. And then we had members of our participation team who engaged with organisations and young people to assist them in participating in that. But most of that continued with BAU and there was no additional staffing that came into the office for that.
Okay, thank you. Another question through you, Minister, to the advocate. you frequently appear before parliamentary inquiries and other pieces of government work on behalf of or with young people, and we certainly appreciate that representation. What are the structures in place, or how is your office set up to ensure that what you share with government is representative of the views of a diversity of young people?
So we do regular polling. So every year we do Youth Week polling, and we've just also finalised our strategic plan tracking report, which everyone would have received. So there's regular mechanisms in terms of quantitative data that we have. When there is an inquiry or a request for a submission, we always start by saying, is this something that we've spoken to children and young people about? If the answer to that is yes, then obviously we use all of that material as the basis for it. If the answer to that is no, subject to timing, then we will try and engage with children and young people around that. Importantly, in some of the most recent inquiries, and I do want to acknowledge all of the committees who have welcomed this and enabled it in a number of ways, is we've brought young people to share their lived experience. So young people came and talked about their experience of loneliness. We had a young person who, and thanks to that committee, appeared in camera to talk about their experience of vaping. And we're currently assisting the committee into the inquiry into pornography to facilitate conversations with young people separate to that, so they can hear directly from young people. But always it starts is, if young people have a view on it and we have that work, then we make sure that that's what's informing the submissions.
And Minister, following up on the work that you're doing to create a new youth agency, obviously the role of the advocate themselves is underpinned by legislation, but how are you going to ensure that in such a new agency that independence is preserved? And I come back to the example of the inquiry into alternative care arrangements, which was so pivotal. It's obviously very important that that office has the capability to be able to criticise government when that's needed.
I mean, just to reiterate, none of the existing provisions, legislative provisions in relation to the role of the advocate are intended to change. So we want to provide more opportunity and resources. And look, I'm not going to talk about forward budget because, as I've already indicated, that's not the role of this budget estimates. But the intention in the creation of the new office or agency is not to change any of the work that is currently being done. The provisions that underpin that will continue unchanged. It's to provide a broader scope for others to support that work and complement the engagement of the New South Wales Government with young people.
And then my final question on this topic, I've been particularly impressed with the Youth Advisory Council, who I'm very grateful to have had the opportunity to meet by the diversity of lived experience represented there, both in terms of life experiences and geographically across the state. What was the work done behind the scenes to ensure that diversity of voices, or what's needed moving forward to ensure that can continue in a new agency?
Well, again, I mean, the advocate can talk about how the selection process for the YAC works, and in fact it is a very comprehensive multi-stage process where the issues that you have raised are front and centre and the decisions that are made about who is on that group. And again, all I can say is it is absolutely the intention of government to continue to ensure that those types of bodies, and in fact potentially more larger, more significant opportunities are provided for young people to directly engage. I mean, that in answer to a question that Ms Mitchell raised earlier, what did young people tell you? That is what they told us. They want to speak for themselves. They don't want well-intentioned old people, well-intentioned as we are, to speak for them. And so the benefit that comes from the current YAC, which I agree with you is significant, is only intended to be enhanced going forward. But did you want, Zoe will be here this afternoon if you wanted to ask her then, but she can talk to you about
So in terms of the Youth Advisory Council applications, this is, and I talk about it quite regularly, it's always difficult because you're trying to get a variety of voices from across the state. And we always know that people who feel comfortable to put themselves forward for an advisory council is but one group, and you want to try and reach those particular people who might not feel as comfortable. So in terms of the representation, we work very hard to make sure that not only are we working in terms of the way that government does in pushing out messages in terms of social media, but also engaging with Department of Customer Service about how they might promote it as well. We also go out to councils across New South Wales, schools across New South Wales, so we have quite a large mailing list that we engage in that space. But then in some particular instances, we try and work hard with particular organisations who we know support. Now, we're conscious of making sure we're not just targeting some organisations as an example, so we want to make sure that we're working across the sector. We also have to be very clear that some people might not want to provide a written application. So lately we have changed that in the last 3 years, I think it is, so that you can do a video application as well. And in those years, because of the shift, we have seen, for example, more people who have had interaction with youth justice or police applying. And so that's a really amazing step for us because they are particularly young people who might not feel like they could be represented on spaces like this. Also out of home care and ensuring that we make sure that we have Aboriginal representation, of course. But also that metro and regional, and so working very hard to make sure that we're ensuring the voice of regional young people are represented. And this year it is a 6-6 divide in terms of metro and regional.
Thank you. If I may, my last minute, I'm just going to come back to mental health. In response to a question on notice, I was advised that as of the 17th of February, no fees had been paid to private locum or recruitment agencies for the placement of locum psychiatrists. It's my understanding that generally those agencies charge a minimum of 10 to 15% fees for placements. How is it that no fees have been paid at this stage? Is it because they're being lumped? Is it because they're being accounted for differently? Can you explain that answer?
I might ask Ms. Pearce or one of the officials. I mean, I should just note, in relation to questions that were asked earlier, the invoice, for example, with VMOs, one of the reasons that we don't have definitive costs associated with that is that they invoice monthly. And so, in fact, a number of the invoices in relation to the work that they have done, and I'm very upfront that they are doing work, we've simply not received yet. And so that's one of the reasons why I'm not able to provide definitive information about the costs of those VMOs, is simply we do not have that information from them yet. It may be that this is a similar issue in that it just the way that the invoice cadence is such that they have not yet landed, but I don't know if anyone has any other information on that.
Taken on notice.
Happy to take that on notice.
Thank you, Minister. We'll go back to the opposition.
Thank you very much. Minister, what's the current wait time for the Link to Home service?
The most current wait time, I will get that for you, is 27 minutes and 2 seconds.
Mm-hmm. Minister, I've had representation to my office from electorate office caseworkers and also from a constituent that over the last 2 months on several occasions that Link to Home service number has been unanswered.
That's very concerning, Ms McLaren-Jones. I personally have not heard that, although thank you for bringing that to my attention. Ms Pinkston, are you aware of that?
No. What happens when a call is unanswered? Does it go to voicemail?
No, it's on a loop. The call's on a loop, so it should be just bouncing between the people on the call centre.
As I said, I'm not familiar with the issue of unanswered calls. I acknowledge that for some people in desperate circumstances, waiting even 5 or 10 minutes is very distressing. So, I mean, look, I'm pleased that when we talked about this at a previous budget estimates, that wait time was a lot longer. It was over 45 minutes, I recall. So obviously I'm pleased that we've been able to bring that down.
Ministers, when you came into government, wait times were around 3 minutes, if that. And under your time as minister, they've gone up to recorded almost 40 minutes. I've had reports where people are waiting far longer, particularly caseworkers, who have got time to wait for 2 hours. But the general public, desperate people that need housing, you're telling them just to wait for that loop.
Well, one of the reasons, well, in fact, the major reason why that wait time has significantly increased is because the number of calls has significantly increased. This is as a direct result of the housing
And what's
crisis.
your solution? Just tell them to wait.
No, our solution is we've already put in place a number of measures that have seen a significant improvement in that wait time.
27 minutes is significant improvement.
Well, it's a significant improvement on 45 minutes. I mean,
which again is under your watch.
Well, as I said, we are dealing with a significantly increased volume of calls. And I take very seriously the wait times that people are experiencing. We had a direct intervention and engagement. I mean, if indeed this had been brought to my attention and nothing had happened and no improvement had been made, then perhaps your line of questioning would be valid. But that's not what's happened.
Well, Minister, I actually
we have
tried
made
to
a
call your office
significant improvement.
About 3 weeks ago on a Friday afternoon regarding a young woman who was pregnant in southwestern Sydney who was looking for accommodation. Again, had tried to reach out to Link to Home. No one was answering a call. She went to an electorate office. No one answered the call in your ministerial office on a Friday afternoon.
Well,
I had to go to another district to find someone who could contact this woman. A pregnant woman on a Friday afternoon had nowhere to go because no one is answering the phones.
You have my personal mobile number, and I think it's quite disingenuous to turn up here and present that as though me and my office are uncontactable when you know full well that any time you want to contact me
Minister, I shouldn't
personally,
be having to call your mobile.
I don't know.
Someone should be answering the Link to Home call.
I accept that even 27 minutes is too long to wait, but it has been an improvement, and we are continuously trying to make sure that we have provisions in place, including extra staff, including additional training, to bring that number down. And the improvement is there. But yes, in answer to your question, of course we don't want people waiting.
Minister, before I move on to my colleague, the department ran their Homeless Innovation Fund information session last year to talk about, obviously, the Innovation Fund. In the report, which is all on the public record, they talked about in the 2023-24 period, there's been a significant increase in people staying in TA. In fact, according to the department, that is increased by 121% over that 12-month period, with an average of 27 nights stay in TA, with a third of people cycling back into homelessness following being in TA. What's the current length of time that people are required to stay in TA?
Well, I mean, there's no length of time that they're required to stay. They stay as long as they need to so that we can transition them into more permanent
But again,
and
it's
stable
not
housing.
working because your own department says that they're cycling back into TA from homelessness.
The reason that we are struggling to transition people out of temporary accommodation into more permanent and stable options is because there is not enough social housing available. This is well acknowledged by me. We're on the record about it. We've put $5.1 billion in the budget to build that housing. We are underway. We are already seeing the benefits of that investment. But yes, we will continue to see people who are staying in TA longer than they want to, and we want them to, until there are more permanent options. But I should also say that one of the things that we've done specifically to provide a better temporary and emergency accommodation outcome is put the Homelessness Innovation Fund in place and spend money to provide supported TA environments. Just the other week,
Which is why I'm asking what is now. You've had the Innovation Fund, I think round 1 and 2 have rolled out. So what's your average wait time now?
Well, the average time in TA, do we have that? Yeah, it's still 26 nights. But as I said...
is that as of last year when that report was put up? Or December?
That's as of December 2024.
Could I get the...
yes, we're happy to take on notice if there's an updated March figure. But we are literally committing money, project by project, to build supported temporary accommodation solutions. Just last week, I was up in Tweed announcing another one. We've announced one in Lismore. They are already rolling out across the state. And the direct purpose of that investment is to build more supported temporary accommodation to address the fact that, look, temporary accommodation is not an ideal solution. Of course, it's better than an experience of homelessness, but we want to ensure that people have got supported emergency accommodation outcomes, and that is the entire purpose of the $100 million Homelessness Innovation Fund, and there are projects that are already committed and online.
I'll hand to my colleague.
Happy anniversary, Minister. It's the anniversary today of the closing of submissions on the short-term rental accommodation consultation report. We're a year on. Just wanting to see, where are we?
Yeah, I mean, it's still under consideration. So we have had so much reform that I'm so proud of when it comes to the housing crisis that we face in New South Wales, and whether that's the reforms to our planning system, rental laws, the Building Homes for New South Wales programs. Short-term rental accommodation is part of that.
So it's on the back burner, is it? Or?
It's not on the, I mean, you know, I don't want to get semantic about the back burner, the middle burner, the front burner. It is not the top priority of government when we're confronting the housing crisis. I'll be upfront about that. The top priority for government in the confronting of the housing crisis is getting our planning system in shape and ensuring that the investment that we have made in building more social and affordable housing is on track for delivery. So the potential reforms to short-term rental accommodation are part of that, but I don't even know, Mr. Fallow, if you would want to assert that reforms in that space are the most important lever that government could be pulling right now in resolving the housing crisis.
No, but Minister, when you announced this reform or this review, you indicated that it would be complete within the first half of 2024. Mm-hmm. We're now in the first half of 2025, and it still seems there's no end in sight when it comes to that review and when it'll be finalised. Have you got a date for when?
Well, I mean, it's not as though it's a review that is going to produce a specific review document. It is a review to inform policy decisions. It is. It is a review
it's
to
a review
inform.
For reform, isn't it?
That's right. It's a review to reform. And what we haven't made a decision on is the suite of reforms that we want to commit to. And the reason we haven't made a decision on that is because there's multiple competing priorities, between, for example, really important work to support local economies that rely on tourists and the visitor economy. Also, of course, as I've been upfront about, certain local areas where the impact of short-term rentals is more significant. It's varied across the state. I should also indicate, Mr. Farlow, throughout this entire process, the door has always been open to local government who want to use the same pathway that Byron Shire did to explore the potential of caps in their local area, if indeed that's what that local council want to do. That's always been an option for them. But in terms of statewide policy, when we're balancing those various competing priorities, making decisions about what the suite of reforms look like, we want to get that right. And sitting alongside all of the other work that we're doing, it's not something that we've finalised yet.
So, Minister, do you think caps work then? If that's your invitation to local government?
I am TBC on it because I want to see the outcomes of the Byron Shire, the Byron Shire caps. So they obviously only came in.
So what do you mean by seeing the outcomes of that?
Well,
Have you got an evaluation program or something to assess that outcome?
No, I understand there are pieces of work that are being done to look at the impact. So my entire goal here is how do we improve the availability of affordable long-term rentals. That's my beginning, middle and end. I am open to any solutions that deliver that outcome. I'm unsure based on the evidence that local caps do or don't work, but happy days, we have an opportunity to explore that exact question in the Byron Shire, but I think it's relatively early stages. I mean, the caps have not been in for that long. We have to cycle through a few sort of summers and winters, I think, to see whether, well, did it achieve that outcome? Or did it achieve unintended consequences? Were there perverse outcomes that we did not anticipate? And I remain extremely open-minded, but I suppose I would say I'm unconvinced either way.
Okay. So TBC, open-minded. What are some of the assessment criteria you'll be using to see whether that was a success or not?
I think the core one is, did it improve the availability of long-term rental accommodation, and in particular affordable rental accommodation? But even I'll just settle for, did, as a result of that policy intervention, the number of long-term rentals available in that community improve?
Okay, so you talk about a couple of summers. So when do you anticipate, and this is fundamental in a sense as to where the government will go in terms of policy reform, how many summers are we waiting to see what happens in Byron?
I don't want to be definitive, and I'm not an evaluation specialist. I do think you need a little bit of time for the consequences of that policy to wash through before you're making definitive determinations about whether it worked or not. So, you know, I don't want to say specifically it's 2 or 3 or 5, but I do think you need some period of time to make an assessment. I mean, another assessment criteria that you may wish to look at, Mr. Farlow, is what impact, if any, did the caps have on the local economy and the local tourist economy? That's a valid question too. For areas of the state that really rely on tourists and visitors, do those kind of policy interventions have a significant negative, or I suppose positive, but more likely negative impact on that local community? And is that something that local community is comfortable with? I think that's an unanswered question.
So, Minister, in releasing the consultation report, you said all options were on the table. One of those, of course, that's been advocated is a 7.5% tax on short-term rentals, similar to what Victoria has in place. What's your perspective on that?
Well, all options remain on the table. I mean, industry itself called for a 2.5% levy, so, you know, there's actually relatively, from the feedback that I've had, relatively widespread support for that, although set at different levels. I have not yet formed a view. Government has not made a decision about what the reforms will look like in the short-term rental space. So it remains the case that all options are on the table.
Okay, so after having the position a year ago that this would be done in the first half of 2024, we're now at the position that this will be done when?
Well, the work has been done to inform potential reform pathways in the time frame that you described, but I'm not in a position to make definitive statements about when government will make decisions about reform going forward that don't sit exclusively within my portfolio. I'm obviously a participant and
well, you're the lead, aren't you,
on this.
when it comes
Absolutely.
to this review? Yeah.
But of course it requires engagement from planning, as I said, from tourism and others, and I'm not in a position to be definitive about when government will make those decisions. Suffice to say that yes, this work sits alongside all of the other work that we have done in housing to try and address the housing crisis.
Okay. Thank you, Minister. We'll continue to watch this space. Now, Minister, turning to a few reports that have come through in a couple of items from the land audit, which are going onto the private market now. So recently there's 11 low-yielding properties that are up for auction as part of the land audit. Just wondering, in a sense, why Homes New South Wales didn't take any of these properties and what those considerations were.
Oh, look, I mean, I can ask Rebecca if she wants to make any comments. I mean, a number of the properties are, from what I understand, is individual plots, individual sites. Our focus at the moment is big, high yield, big impact sites. And to the extent that we have engaged with the land audit, and the obvious one that comes to mind for me, well, there's two really. There's the dive site on Palmer Street and William Street, and there's the one over at North Everleigh. They are larger developments of a significant scale. The ones that I think you were describing are much smaller plots. And I mean, the answer is bang for buck. We want to maximise that. We want every public dollar that we're spending on housing, including through our Building Homes program, through the land audit, to deliver the maximum benefit. So
the sale of these properties, will the proceeds of these sales be coming back to Homes New South Wales at all, in terms of, or how will that be?
You'll have to ask Minister Camper about that. He's responsible for the land audit and the management of the sales of those properties.
Okay, but from a Homes New South Wales perspective, effectively you have first dibs when it comes
we do
to any
have
items.
First dibs,
so if you forego that, is there any monetary compensation for Homes New South Wales in terms of a sale or yield?
No, I mean, the process is, you're right, we have first dibs. I mean, as I said, I've got the sites here. I don't know why we didn't submit a request for 11 Clavering Road Seaforth, but perhaps Ms Pinkston may be able to elaborate this afternoon. But we do have first dibs, as it were. Landcom has second dibs. Yep. And if we choose not to use those sites because, as I said, most of them here are small plots, single dwellings that do not deliver big bang for buck. Then Property and Development New South Wales under Minister Camper, manages them in a way that I don't have direct line of sight on.
Okay. Thank you, Minister. Minister, with respect to the social housing waiting list, this is another position where, similar to the questions Ms McLaren-Jones was referring to, we've seen significant growth over the last 18 months. What are some of the things you're doing in terms of being able to attack that social housing waiting list, considering that even with the budget allocation, it wouldn't reduce it with 8,400 new homes, it wouldn't reduce it to a level the same as
I tell you what we're doing
18 months ago.
We're building new social housing as opposed to selling it. And fundamentally...
But Minister, under your watch, this has grown by 15%.
That is because of underlying factors in the economy that are associated with the extreme cost of living crisis. It's really hard. It's really hard for people to afford housing right now. The cost of housing, the cost of renting has jumped significantly. That is putting pressure on people such that they are putting their hand up for social housing because they can't afford to buy a home and they can't afford to rent a home, and we are the safety net that exists for them. Do we have enough social housing? Absolutely not. You sold $3 billion worth of it. We have put more than that.
The social housing waiting list is jumping up
in the
on
budget.
Your watch.
The social housing waiting list is something that is caused by factors that I wish I could control, but I can't control. They're beyond the control of government. It is a consequence of the operation of the private housing market, not even the state economy, the national economy, the global economy. That puts pressure on people such that they cannot afford rental in the private market, or, buying a home is completely out of reach. They turn to social housing. That drives the demand. We are doing what we can to meet that demand, but because of the policies of underinvestment for over a decade and billions of dollars sold off, it's a huge hill to climb. We've put the money in the budget and we're getting on with building the homes.
Minister, the number of people with disability on the social housing wait list has increased by almost 1,000. A question I noticed was put to you last year asking for details about the number of people with disability in social and community housing waiting for home modifications, of which there weren't any answers forthcoming. Will you be able to provide the committee with an answer today on that?
Look, I don't know if I have. I might ask Rebecca whether she has the specific information about the number of people who have requested, current tenants of social housing who've requested a modification because of disability. Is that the...
Yeah.
I don't have that at my fingertips. Ms Pinkston may be able to look it up. I do have information that an average of 2,243 properties have been modified for disability modifications every year. So Ms Pinkston may be able with the team to see whether that figure that you have requested is available.
Thank you.
Yeah.
Of course.
Ms Higgins.
Thank you very much, Chair. Hello, Minister. I have some documents to table, if that's okay, before I commence some questions in relation to one topic, and it is, I'll wait till you see the Minister. I also wrote to you about this issue. This is a matter concerning the Thornley Reservoir.
Is this the, I'll have a look at the documents, Ms Higginson, but is this the mapping issue? Is that part?
No, this is about a safety issue.
Right.
Thank you. I provided lots of copies. Thank you. So, Minister, if you would just have a look at the documents the Secretariat's giving to you, you can see there that one is looking at the reservoir status and risk classification. It appears from those documents Thornley Reservoir is operating outside of the safety threshold. In the event of reservoir or dam failure, it has on that document 147 people would be at risk of death. Minister, in your response to my letter dated 17 January, and your response 20 February, you acknowledge that Sydney Water considers Thornley Reservoir to be out of risk tolerance due to missing geotechnical information. However, these documents show that the reservoir is operating outside the safety threshold, a classification which indicates a serious structural risk. Can you confirm whether Thornley Reservoir is currently operating above the safety threshold?
Where's Mr. Shiro? We actually don't, perhaps, despite having so many officials here, we do not in fact have representatives from dam safety. So perhaps another one to add to the list. I mean, so Mr. Shiro.
So, Minister, perhaps does the document concern you? The one in front of you, the one.
Any suggestion that one of our many dam assets is operating outside the safety threshold concerns me. I'm not in a position, just based on this, Ms. Higginson, to give a definitive answer as to whether, as of today, that is accurate information. I don't know whether Mr. Shiro or Ms. Jones may have that information, otherwise we'll have to take it on notice. In terms of a definitive answer today, what is the status?
You want to, yeah, I mean, happy for you to take them on notice, or?
No, I probably can bring some information about Thornley Reservoir. So this is coming from the fact that there was a study done, that's probably back in 2024, where the geotechnical survey information was actually missing. So, and it goes back to the construction of the reservoir, so many years ago, because that's a reservoir from memory that was built in the 50s.
Perhaps if I can just interrupt the document. Are you aware of the document?
Yeah, absolutely.
Yeah, so could you, just because we have such limited time, are you able to address whether...
Well, I mean, this document isn't even dated, Ms. Higginson.
Well, the document is from a report. I have the full report. It's a report that... as you say, is the 2024 GHD report. It's an analysis, an individual and societal risk rating assessment, and Sydney Water has this document. You actually produced the document under GIPA recently with this not included, and I just, look, perhaps you should take some of these questions on notice. The documents indicate movement in the dam embankment and a split in the liner, suggesting serious structural instability. However, your response does not address those issues directly. So the questions really are, right now, has Sydney Water identified evidence of embankment instability or liner failure beyond the missing geotechnical information? If so, why has Sydney Water not acted to mitigate these issues?
So there is no movement in the bank, so sensors have been put in place to check if that was the case or not. So it's not the case, so the embankment is not moving. And I want to come back to the first question, which is a very important point. The only reason why this dam has moved to the next category is because the geotechnical information is missing. The geotechnical survey is being done, and I'm confident that when it is done, when GHD or another engineering company have the information, then it will move back into...
And when do you expect that work to be completed?
That's going to be completed this year, in this financial year.
Yeah. So by the middle of the year.
And that will be made public? Is that something that was public? And so in that context, why has Sydney Water not objected to a road at the moment that is considering bulldozing into that embankment?
So we haven't made our position on the roads. We have said that we were going to work with the council that has expressed a wish to have a road going through the land that is adjacent to the reservoir. But we've also made very clear to the council that it could not come at any risk to the infrastructure that is existing on the land.
And I'm happy to endorse the point that Mr. Shiro just made, which is we do try and work with proponents when it comes to infrastructure like roads to see if there are potential solutions, but it's non-negotiable that the safety of our assets is front and centre. So obviously, as Mr. Shiro says, the relevant reports are being finalised, but I can give you an assurance, Ms. Higginson, that there's no compromise on those safety principles when it comes to the position of Sydney Water or Water New South Wales, which is another asset owner, on safety.
And so, do you have any idea at this point how what the cost would be if the wall had to be replaced or fixed, or you don't have any of those cost analyses at the moment? Okay, thank you. And look, I'm happy to put more questions on notice in relation to this specific issue. It's raised some real concern, obviously, particularly amongst the residents and the 129
Absolutely.
people.
Dam safety is incredibly important. I understand that.
I can confirm, Minister, that Thornley is on the list of 17 at-risk dams, and the work that Sydney Water is doing is being reviewed by Dam Safety New South Wales.
Thank you. And just one last is, Minister, will you be reconsidering a financial support to the Human Nature program in the Northern Rivers that I've written to you about, and particularly now?
Yes, I will be considering that, and I will have more to say in the coming period in relation to opportunities to provide support to them. And I did meet with them after you raised that, and yes, there are opportunities upcoming.
Thank you.
Thank you. Okay. This is in relation to PFAS. So is the North Richmond water treatment plant water being tested for PFAS?
Mr. Shiro is currently just chatting with Ms. Higginson, so that's okay. Mr. Shiro, the question was North Richmond water treatment plant.
Is it being tested
testing.
for PFAS?
Is it being tested for PFAS?
Yeah, it is tested.
Yes, it is.
Okay. So what is that? Is it? What is that revealing?
It's saying that it is below the Australian drinking water guidelines, compliant with the Australian drinking water guidelines.
So the new drinking water guidelines or the current?
So it is compliant with the current.
Sorry, the draft, I should say.
And it is going to be compliant with the draft ones as well.
Okay. Why, in terms of North Richmond, I understand it's not run by Sydney Water, so local councils are the authority, is that correct, or is it?
No, it's run by Sydney Water.
Okay, all right. And the pipe, in terms of Baker's Lagoon, there's various contamination sources, PFAS contamination sources. Somebody from the area has said to me that for the last, well, at least the last 6 years, that pipe, there's a pipe that hasn't been blocked off in terms of Baker's Lagoon. Is that correct?
I need to take
maybe
that
take
on
it on.
notice.
Yeah. Okay. Maybe take it on notice. So, in relation to Minister, the unregulated water sharing plan. So, these are the replacement water sharing plans for the unregulated valleys, which are due to be made, I think, by June this year. So will all the connectivity expert panel recommendations for improved connectivity to the Barwon Darling be implemented at the commencement of the new plans?
No, unfortunately, we will not be able
to
meet that time frame. Having said that, Ms. Fairman, as you know, I can make, with concurrence of Minister Sharp, I can make amendments to plans at any time in the public interest. And so we are committed to finalising that work in relation to the connectivity panel. Also, of course, the minimum inflows work that the Office of the Chief Scientist is leading, which overlaps and contributes to exactly the same concerns that you have that I accept are valid. But no, I should be clear, I will not be able to have all of that finalised, ready for inclusion in the plans when they are remade at the middle of the year.
Okay, so how are you reassuring yourself that those important low flows needed to improve the environmental health of the unregulated water sources are protected in the new replacement water sharing plans?
There is a review clause in the draft unreg water sharing plans that reflects consideration of the connectivity work.
So, but also we have ensured that the provisions in those plans as they relate to, for example, more cautious, I guess I'm looking for the right word, targets at Menindee and other areas are included. But having said that, Ms. Fairman, so we've done that, but as I indicated, once we are clear on the outcomes of the connectivity panel work and the minimum inflows work and that other work, it will be included in the water sharing plans. It's just not, unfortunately, going to be able to be done in time.
Okay, so what methods for measuring those low flows in the unregulated water sources are being considered prior to the installation of gauging stations? And this is around, there's not, I understand there's some places that don't have pump metering requirements, for example. So is anything being done for that?
Well, I mean, I'm happy to take on notice any specific areas you have. I mean, obviously, we are committed to a proper, comprehensive rollout of pump metering, and I recognise that has been not nearly as comprehensive and rapid as both you and I would have hoped, and we've done a range of pieces of work, and I mean, Mr. Barnes is here and you can ask him now or this afternoon in terms of NRA's engagement. Suffice to say, my expectation is that all pumps above a certain size, I mean, obviously the very small ones will continue to be exempt, but the ones that we would be worried about should be metered.
Okay, I'll come back and I will get more
I
detailed, have a more detailed discussion with you this afternoon on that, Mr. Barnes. Minister, the Nature Conservation Council recently undertook a legal case against the Water Minister, New South Wales Water Minister, challenging the making of the New South Wales Border Rivers Regulated Water Source Order 2021. What were the settlement terms of that case?
Oh, I will see if I can get that up. I was pleased to be able to settle that matter. It included things like the minimum inflows review. It included regular meetings. It included other provisions. Amanda, are you able to
We actually,
recall
on our
those?
website, we've actually got a page that references all of the terms and the status of all of the actions against those terms.
Okay. Were there any restrictions placed on the organisation relating to talking about the outcomes of the case or bringing forward any future cases? Was there anything like that?
Oh, I can't recall that.
No, Minister, I don't.
Yeah, no, I don't think that there were. We want, I mean, I inherited that suit, just to be clear. It was a suit that was initiated against a former Minister for Water, and it was really important to me that we resolved that on good terms, and that we, as Ms Jones said, are upfront and honest and transparent, and at least one of those terms was regular meetings between myself, the NCC and Minister Sharp, and they, with the opportunity to update on those matters, and they have been occurring.
You'd kind of hope that you wouldn't require a legal case for the Environment Minister and Water Minister to meet with the peak environmental organisation in the state regularly.
Me, but
what about the documents that were made available through the discovery process of that court case? Would you make those documents available publicly?
Look, I don't know what those documents are, Ms Fairman, so I don't want to make a definitive statement about making documents publicly available when I'm not sure what they are. But I reiterate, I'm very committed to transparency. If you believe that there are documents that you think should be made publicly available, I'm happy to take information from you about what they are and attempt to make them publicly available. I don't have anything to hide in relation to this matter.
Okay, thank you. Minister, in relation to longwall mining in Sydney's water catchment, I understand Water New South Wales has expressed concerns reasonably consistently regarding the mining in the catchment, in particular around the kind of current activity that's going on in terms of Metropolitan Mines, which is Peabody's mine in Sydney's water catchment, and they're currently seeking approval for extensions. Are you aware of those concerns?
Yes, I am. I've spoken to Mr George about it, and you are correct that Water New South Wales has those concerns and has made submissions along those lines.
So in relation to have you also made approaches to the Planning Minister about your concerns as Water Minister and the potential impact, or the impact, of longwall mining on Sydney's water catchment?
Look, I've made sure that in the consideration of planning decisions, that the Minister for Planning and his team are aware that Water New South Wales has a view and has made a submission along those lines. And of course, my expectation that is taken into account. So, Andrew can talk now, or you can ask him this afternoon about what those concerns are. He has briefed me. We have talked about it. Those submissions are publicly available, I should think, Andrew. Thank you. Yeah, it is my expectation that they are taken into consideration.
Yes, okay, and because I understand there's 2 recent reports on Warrenora that suggests that the Warrenora plateau, which suggests that the mine is jeopardising Water New South Wales' ability to meet its core objectives and functions in relation to the protected catchment. That's essentially where things are getting at.
Yeah, so that'll be in relation to our mining principles, which we do publish on our website, which speak to the integrity of the infrastructure.
There's a legislated obligation to
correct, correct, to catchment protection.
That's right. Okay, thank you, Minister. The Sydney water and biosolids regulation. My understanding from looking at going through, it's a slow exercise, but I'm slowly going through the 130 boxes that were returned on PFAS under Standing Order 52. Some of those papers and emails that I've seen suggesting that in terms of the upcoming regulation of PFAS in biosolids, which hasn't taken place yet, that there's going to be something called a soft regulatory approach phased in over 5 years. Have you been informed by Sydney Water that if this PFAS biosolids regulation comes in, that much of the waste that is currently being applied on agricultural land in New South Wales as fertiliser will be deemed hazardous waste?
I have had discussions with Sydney Water in relation to, as you say, the upcoming regulation of PFAS in biosolids. I'm aware of that issue, and I'm aware that it presents a challenge to Sydney Water in not dissimilar terms to what you have described. So obviously I'm concerned about that. I'm engaged with Sydney Water on it. We await in a way the framework that the EPA will put in place, but yes, you are right to raise it. And
thank you. I've got 15 seconds left. So the last question on this then, given that, as Water Minister, have you taken it upon yourself to potentially lobby for the phase out of PFAS and a banning? We've been approached by many stakeholders suggesting that's really the only way we can deal with it.
Look, I haven't taken that on as yet. It's not something, I have been very engaged in the management of the exposure of our drinking water and our biosolids to the risk of PFAS. I don't want to pretend I've been out there actively lobbying in relation to the matters that you've raised, but I understand fundamentally your point is valid, that we can do what we can do to manage the risk. It would be better if these forever chemicals were not present in our environment.
Thank you.
Thank you. We have a few minutes remaining for the opposition. Mr. Farlow.
Thank you very much. Minister, in September of 2023, when you cancelled the plans for the redevelopment of the Argyle estate, you outlined that there'd be a new local area plan to deliver housing for those in need in the Coffs Harbour area. Just wondering, what is the progress with that plan to date?
Well, we've engaged significantly with the local community. As you rightly say, the local community were very clear to me that they did not support the previous proposal in relation to the Argyle estate. It would in fact have delivered less social housing bedrooms than were presently available on the estate. So clearly that was not an acceptable outcome to me. We have done things like a lived experience survey of the community that has been underpinned by broad community consultation. We are identifying opportunities for social housing investment in the Coffs Harbour area. We will hope to have more to say on that in the near future as we work through both our own processes for capital expenditure and our engagement with the Commonwealth under the Housing Australia Future Fund. But suffice to say, the community is on board with the approach that we are taking, which is quite different to the circumstance that we inherited.
So, Minister, one of the, you outlined in terms of the number of bedrooms and the like, but one of the issues that was flagged as part of the 2021 LAC Coffs Harbour LGA analysis identified that there was a large supply of 3-bedroom social housing cottages that exceeded the current demand for families on the waiting list, and particularly that there was a need for 2-bedroom dwellings. Is that still the case in the Coffs Harbour?
Look, I don't have information to hand about the current demand profile in the Coffs Harbour LGA, but I'm happy to take on notice whether that information that you just provided remains accurate.
Thank you.
Minister, last year I asked in budget estimates about 14-year-olds presenting to specialist homeless services alone. You advised, and I quote, "In the client information management system, the pop-up alert warns the user that the support period being created for a child under 14 years on their own. This alert is not stored and therefore the data is not captured." Now, I'm sure the staff are aware that the child presenting to an SHS is a minor. I asked you then about data collection, and you indicated that the HIF could be used to improve data development. I'd like to know how much has been allocated out of the Innovation Fund specifically to capture data around young people, and these are 14 and under, presenting to SHSs.
Look, I mean, I might have to take that on notice unless Ms Pinkston has that to hand. I mean, the HIF relies on applications being made, so, you know, we would need our partner organisations who run specialist homelessness services, to be willing to put forward applications under that, although, as I indicated, we would absolutely consider them. I do know that some...
So you're basically saying it's their job, when in fact you are the minister, you have children under 14 presenting alone, and the only thing that's available is a pop-up alert to tell them what they pretty much clearly know.
As I said, it's not, you sort of suggest that there's some like arm's length there. Our NGO partners deliver specialist homelessness services. We work with them, but they are organisations that we don't run and control. They are non-government service delivery organisations, and we love them and value them, but no, we don't tell them how to make applications to the Homeless Innovation Fund. That's a decision that they make. And I welcome that, but as I said, I'm happy to take on notice the specifics in relation to whether any applications have been made or approved along the lines you suggested.
Thank you. Minister, I just wanted to come back in the time we have remaining before lunch to private hospital care, and understand that that is currently only happening for voluntary patients.
Yes.
Do you have an understanding of the rates currently being paid to the hospitals and to the private psychiatrists for care of public patients?
I don't have that on hand. Do you have the rates? I do have information that suggests that there are currently 17 patients being cared for under those provisions, obviously, as you mentioned, in a voluntary capacity. I don't have those rates. We'll have to take that on notice.
Okay, thank you. I have asked this as a question on notice, and the answer that I got was that the cost per patient per day is determined by the contract between the private hospital and the LHD. The daily rate would vary depending on the contract and the operator. So I'm interested, I mean, from your perspective as a minister with statewide oversight, is there an approved range for those contracts? Is there a cap on those contracts? Appreciating there's some variation, but can we get a sense of the quantum,
we
please?
can deal with that on notice further for you, Dr. Con. What I would say is that we've worked a lot with private facilities over the last number of years, and we have sought to have arrangements where we have some consistency in the rates that we're being charged for the use of any private services. So I'm sure we'll be able to provide you something on that, so long as it's not a commercial in confidence arrangement.
Thank you. To clarify, I'd be very interested in a range or a cap or some indication of the quantum without breaching your commercial arrangements. Thank you. Similarly, you very helpfully answered some questions this morning, Minister, about the status of the resignations and how many psychiatrists were in what status at the moment. I'm interested to understand if you have specific numbers for forensic psychiatrists, noting that that's a very specific role. It was reported, I think back in January, that they were anticipating at least 30 resignations of forensic psychiatrists.
Yes, I may have that. I do accept. I have information as of the. Does that include the forensic?
I'm just trying to.
Perhaps we will have that information at the beginning of the next session. I just don't want to waste your time right now. We do have that information broken down specifically for forensic. When is this?
Wednesday.
This is as of Wednesday. We have 30 resignations that were indicated, 5 separations finalised by Health Share, 8 withdrawn, 15 deferred, 16 transitioned to VMO. So that's just within Justice, Health and Forensic Mental Health. Thank you, Ms Pearce.
Thank you very much. That's helpful.
I just wanted to let you know, Ms McLaren-Jones, I suspect this will not satisfy you entirely, but we have seen the link to home average wait time as at the end of February was 16 minutes, and I think March to date, which is obviously only halfway through the month, is 12. Okay. So yes, 12 minutes is too long to wait, but we are improving.
Thank you. It is 12:45. Are there any questions from the government?
Thanks, Chair. The government members don't have any questions.
Thank you. That being the case, thank you for attendance this morning, Minister, and we'll see the rest of the witnesses back after the lunch break. Thank you.
Okay, good. Thank you, everyone. That was good.
we'll start with questions from the opposition. Mrs Mitchell.
Thank you, Chair. I am going to, I think I might just do water questions, so it'll probably through yourself, Ms Jones, but potentially some of your other colleagues here as well. I wanted to just ask for an update on, I think it's the Lostock Dam Glennies Creek Pipeline project. The final business case was due in the second half of 2024. Do you know if that's been completed?
The business case is completed or near to completion. It's for review.
Okay. Do you have any indication of a time frame of a decision on that project?
Not at the moment. It's not gone to INSW or ERC as yet.
Okay. And then another project, the Malpas Dam Wall detailed design and tender documents were expected by the end of last year. Do you know if they've been completed as well?
No, I'm not aware of the Malpas Dam project. I can take that on notice.
Okay, that would be great. Thank you. The Water Administration Ministerial Corporation and the Water New South Wales 2025-2030 pricing proposal that's currently with IPART. Some of the information that I have is that there'd be higher water bills for high security customers and quite significant increases on the Peel, the Lachlan, the Murray as well. Is there any indication of, I guess, what customers would be getting in return for those price increases?
So the WAMC component, I should explain WAMC, the Water Admin Ministerial
I wasn't sure how to pronounce the acronym, so please, thank you, Ms Jones. The WAMC.
It doesn't roll off the tongue like many things in water. That entity is actually the department, plus NRA as the compliance agency, and a part of Water New South Wales that does part of the licensing and approvals process. So that is the WAMC part, and the WAMC part is all about setting the rules under the statutory plans, making sure the rules are complied with, and making sure that these transactional services that go with that, licensing approvals, are undertaken. So that component of the bill actually appears on as part of the bulk water bill from Water New South Wales, and I think the question you're going to about the pricing impacts in particular valleys, I might ask Andrew George to speak to.
Sure.
So in terms of what do customers get for the increase?
Well, I guess that's the...
So obviously our pricing proposal to IPART details in quite a bit of detail what contributes to the makeup of those bill increases. It obviously varies by valley around the Murray-Darling Basin, largely because of the different levels of entitlement in each valley. So the large valleys, particularly in the Southern Basin, have a lot more entitlement or customers. Compared to, say, the Peel and Namoy, which have a much smaller customer base to spread costs. Now, our costs in those valleys, which is our pricing submission was based on the costs in the revenue required to meet our obligations over the next 5-year period. The pricing outcome is by applying those costs through the IPART economic regulatory model, the building block model. So it's not that the prices have been recommended, the prices will be determined by IPART. What's been put forward are the costs. More than half, about 55% of the increase in costs are due more broadly to the broader macroeconomic environment. So we're going off a low base from when the last pricing determination was made, when interest rates were at historic lows, to the current environment where interest rates are a lot higher.
So I guess part of the reason, I guess, why I'm sort of asking about the return for customers is that my understanding is that in the pricing proposal there's a reduced expenditure and there's about 860 million in capital projects that have been deferred, and a reduction in operational costs as well. And so I guess what I'm trying to marry up is an increase in cost, but arguably less investment in things like capital projects. So, I mean, how does that play out in practice?
Yeah, great question. So our objective through the consultation we undertook with customers over the last 18 months, 2 years, was to try and strike the balance between significant upward pressure on bills because of that broader macroeconomic environment.
Yeah.
And the amount of risk we take on in managing our assets. So when we ran through our typical asset management process, we would have a very long list of candidate projects. And if we had put all of those projects into our pricing submission, we would have obviously contributed more significantly to the price impact on customers. So we had a conversation about the level of risk we take with our assets, their availability, the amount of redundancy in the systems, and there is good redundancy in a lot of our systems. So we took the decision to defer about $860 million in CapEx to try and take the pressure off customer bills. Now, we did the same with OPEX as well, so driving a fairly significant cost-saving program through the business to try and reduce the amount of operational costs that get passed on to customers.
Okay. Just moving on from that, just back to the 300 odd million for the environmental flows that I asked the Minister about earlier, and I'm happy whether it's yourself, Mr. George, or whoever who answers this. In terms of, I guess, the Water New South Wales' individual projects in your capital expenditure program, where does that one sort of rank? Are there others that are bigger? What's the next big project after that particular one?
Yeah, so from memory, that is the second largest project.
Okay.
The largest one that in our pricing proposal is the Warragamba Climate Resilience Project to address the climate change and associated dam safety risk.
Okay. And then, so other than the Warragamba one and that one in the Hawkesbury, what else is sort of on the list for priority
The next largest program of works was around the proposed fishways in regional New South Wales.
Okay.
We have significant investment proposed in digital technology, particularly for water market systems, data governance and cybersecurity.
Okay. And then for, this might come back to you, I think maybe Ms Jones, but I think in last year, in the February estimates, we're asking about the prospect of raising the storage at Burrendong Dam, and I'm sorry I'm jumping all over the place geographically, but I've just got a bit of a list that I'm trying to get through my time. I think it was lifting the proposed storage to 120% of the current full supply level, and I know that it's something that the Western Councils have been raising with the Minister and with government. Is there any sort of plan to look at that project?
So I think that's a change in the water sharing plan to lift the availability of water to take up the mitigation space.
Yeah.
That's not determined. It's still under consideration as an option.
Okay. Is there any sort of modelling that indicates, I mean, sort of, I guess without significant or consistent inflows, how long it takes for Burrendong to kind of get to the higher levels of capacity? Is there any work in that space?
I'm sure we do have modelling on different rain event forecasts, so different assumptions about weather.
Yeah.
As to the impacts of that option.
Yeah,
I can't bring them to mind right now, but if you wanted us to take that on notice, we could provide that.
Yeah, that would be good.
Yeah.
And I guess the other sort of side of the question is around, at the moment I think Burrendong's listed at being at 52% capacity, but also I guess from a departmental perspective, is there kind of a figure that you use when you start to consider Burrendong to be low, and when you would maybe start to get concerned about water supply, which I guess is the opposite side of the coin, but I mean any information on that you can provide would be useful.
Can do. And Andrew, did you want to make any comment?
So we do have drought response plans for all of the valleys in regional New South Wales and Greater Sydney. So in those regional drought response plans, there are triggers for implementing actions which relate to other regulatory instruments that within the water management framework more broadly.
Okay.
We have the extreme events policy, and obviously when drought is declared in a catchment, then the priority in a water sharing plan flips to basically towns.
Yeah.
And yeah.
Okay, but if you can provide something around the modelling on notice, that would be fantastic. Wanting to move now to SIDLAMs, which again I think we've asked about the last few estimates hearings as well, and particularly the 2026 deadline for the accelerated projects. where again is that up to? And my understanding is that there was tendering for a managing contractor, but then that didn't go ahead, and I think we might have even talked about that last time. But where are we at in terms of those deadlines and meeting them?
Yeah, no, absolutely. So you're correct. We did look at a managing contractor approach, and we determined that wasn't going to offer value for money. So as recently as last month, we've held industry briefings in Moama and in Deniliquin, and instead where the department's taking on more of the oversight, risk and management, if you like, of those projects. And
instead of having a managing contractor?
Instead of having a managing contractor. And we are very conscious there's about 77 sort of sites for these projects. They're very dispersed. So we're very concerned about work health and safety. So we're making sure that we're geared up to manage that aspect as well.
Mm-hmm.
But we've held industry briefings in February in Deniliquin and Moama. We're in the process of procuring, and we have awarded a number of contracts already for some of the projects.
Mm-hmm.
So those are all moving forward, and our absolute intention is to deliver them by December 2026.
Okay. And then I appreciate that the government obviously decided not to proceed with the managing contractor, but do you have, and I'm happy if you need to take it on notice, a costing for what that tender process was? Not actually the cost of the tender, but presumably there was some cost involved in running that process before a decision was made to change.
Yeah, those costs are only internal management costs. We didn't pay tenders any costs. So yes.
Okay. If you can take on notice that, that would be fantastic. Is there any concern, and again I appreciate, I know it's a different issue, but the Minister and I, I was asking the Minister this morning about increased costs around the Cobar pipeline, and obviously we know rising construction costs have an impact on all agencies and industries, but have you done any work as an agency in terms of whether the 311 million that's been budgeted for the SIDLAM acceleration projects and the Reconnecting River Country program, will they be enough money to be able to deliver what you need based on, I guess, the current budgetary situations?
Yes, we have, and at the moment we are confident about that. And to your question this morning about the Nyngan to Cobar pipeline, you gave the example of, I think it was 9 million to build a section back in 2017. Yes. Construction escalation's about 30% since that time, but I think more importantly, the project you referred to was quite a simple construction of pipeline in sand, and the scope for the 110 kilometre replacement of pipeline includes valves and other parts of continuing the water to pump through the system. It's clearly a lot longer distance, and it's through different topography and different soil type and conditions. So the scope is probably not comparable in addition to construction escalation. Yeah.
But I guess just now in terms of this, you're not concerned that the budget is not enough to deliver the projects for those?
No, we're not at the moment, no.
Okay. And when you said that you're going to do, I think, and I'm not trying to put words in your mouth, but rather than go to an external contractor, more will be done internally on those projects?
Well, the project and program management will be done internally, because that was what the managing contractor would have done.
Yes, yeah.
But we are procuring local, more regional construction companies, including First Nations companies, to actually do the work.
Okay, and will you be engaging any additional staff within your agency to help work in that space as well?
We will. We'll have about 100 staff internally to manage this. That there'll be a mix of ongoing staff and temporary contracts, and we expect to generate about 300 jobs in the contracts that we let for the works.
Okay. Do you have a breakdown of those 300 jobs? Sort of how many will be located in which region?
Not here, but we can
possibly
provide some estimates if you...
Yeah. I mean, I'm sort of interested in, I guess, Riverina, Murray or other regions where the work will be undertaken as best as you can if there's a breakdown.
That's why we have done the industry engagements in the regional centres.
Yeah, okay. Thank you. This Sydney Water, couple of questions. Sorry, I might get Mr. Shiro to come up to the microphone. Thank you. Nice to see you again. I just wanted to ask you about the accounting error that was in the annual report. I guess at what point was that error sort of fully understood, and what was the process around that? The 440.8 million I'm talking about.
So the error was not in the annual report. It was in the numbers that we sent to Treasury.
Oh, the half-yearly review.
Yes.
Yeah, sorry. Yeah. But it delayed the annual report. Is that correct?
Not really, no.
Okay.
So what happened is that in November 2023, in the numbers that we sent to Treasury, there was a misclassification between deferred tax and current tax. So the tax number was right, which is the number that you look at,
Mm-hmm.
but the misclassification was between current tax and deferred tax. So what happened is that Treasury took the current tax as a revenue for the government, as they should, and deferred tax for future revenue for government. And that had an impact on the revenue for government, so it inflated the revenue for government.
Mm-hmm.
When we discovered the misclassification, so we had the discussion with Treasury,
Yes.
and then it was reclassified in the right way, and that's when it created actually a decrease of the revenue for government. So if you picture the tax, which is a revenue that we pay to government, the overall tax number was correct, but the current tax, which is what's come in the forward estimates, was inflated. The deferred tax, which comes in future periods, was reduced.
Okay.
That's what happens,
Okay.
and then we corrected the error, and consequently the revenue from government decreased.
Yes. Yeah. Okay. And then I just wanted to pick up on the issue of the annual report. My understanding is that it was due at the end of November, but it was released on the 25th of February, which is sort of 3-month delay. I mean, that might be a matter for the minister rather than yourself.
I think it's a matter for the minister. We submitted the annual report by the deadline that we have to submit it to the minister.
Yeah, okay. And is it your understanding, and I appreciate if you can't answer this, but that I guess dealing with that sort of accounting error might have been a reason for the delay, or is that not something you're able to answer?
That's a question for the minister.
No, that's okay. That's all right. That's fine. I'm just wondering if I've got anything else for you while you're sitting at the table. I probably do. Oh, yes, I do. Just in relation to the IPART determination for stormwater costs at the Marmray Road precinct, are you able to tell me, I guess, how the costs kind of compare to other similar precinct developments in terms of stormwater management?
Yes, I am. Even if this scheme is very special in the sense that usually when we talk about stormwater in New South Wales and most commonly actually across Australia, we're talking about stormwater that are on-lot stormwater. So it means that a commercial customer, warehouse, for example, will have to, on their lot, will have to use part of their land to construct a basin to store the stormwater, and that's usually what we consider as a typical scheme. Marmray Road is actually very different. So all the idea behind Marmray Road was to say, well, actually there is a better way to use the land, and instead of having a basin on each piece of land, it's probably better to have a number of basins that would be shared between the different landowners. And that's a way to have more land for development, so it's beneficial for the developers. But at the same time, it creates a situation where they have to contribute to the assets that are shared between all the landowners.
Okay.
So that's exactly what happens at Mamre Road. The cost that we've got, which is currently the infrastructure contribution, is let's call it 850,000 per hectare in 2024 cost. And you would compare to a typical on-lot scheme, that would be probably between, let's say, 600 and 800 or 900, meaning about the same cost. But on an on-lot solution, you don't have as much land to develop. So actually, when you look at it from a community perspective, you're giving more land to develop for commercial activity, and it's costing sometimes slightly more, but more or less the same cost. So overall, there's a lot of benefits doing things that way.
Okay, I might come back to that, but I think that's my time. So thank you for now, anyway.
I might come back to Dr. Wright and Dr. Flynn, please. I had questions this morning about the declaration of private hospitals for involuntary mental health care, and I interrupted you to focus the Minister on the conflict of interest issue, but could you detail now the other considerations that you're making in that regard?
I think we were talking about some of the governance processes, and particularly what this contingency is about is that in the event of a loss of bed capacity in our system, the purchase of private beds, including declared private beds from the private sector, is something that we want to have available. But it's not about initiating referrals from within the private system. It's about initiating referrals from our system, and it would be a referral done via one of our psychiatrists, and that the governance of that would mean that there's an expectation of ongoing monitoring of that person's progress, and agreements around the duration, the treatment, and managing the outcomes, and quite often a transfer back into the public system when the bed becomes available. The other comment that I would make is that anybody who is an involuntary patient in any part of our system, whether it's the public or the private, would be under the jurisdiction of the Mental Health Review Tribunal, which is, as you know, is an independent organisation that monitors the appropriateness of care for those individuals. And so we have, we believe, both from within our system and outside of the system, checks and balances to ensure that the treatment decisions are in the best interests of the consumer.
And you mentioned in that answer ongoing monitoring of someone after they'd been transferred to a private facility. What does that involve? What powers does the public system retain?
Well, I think that there will be a contract at the back of it, and it's about active contract management across the whole system. But it would also be there's a treating team that would have had some involvement with the individual from the public system, and our expectation is that they maintain contact with the treating team within the private system. And so it's not a one-way street. That ideally, if those two systems work effectively together, there's movement backwards and forwards, and there's communication between the treating teams backwards and forwards, because it's occasionally it's possible that the transfer into the private system turns out to be less than ideal, and so then the option would be for that person to move back into the public system, and so we would totally expect very, very detailed communication, especially if we were rolling this out for the first time between the respective services. And we've had conversations with our directors of mental health and our clinical directors about ensuring that those that have the private facilities who've shown an interest in this, that they are having very, very active conversations with them about what these arrangements might look like.
For those private facilities that you're saying have shown an interest in this, what confidence do you have in their staffing expertise and experience in looking after involuntary patients, not just psychiatrists, but the whole team. It's obviously a very different style of delivering care.
Well, I think the point I would make is that the process to pass muster with the licensing authority and to have a sufficient degree of comfort on both sides is that there's quite a few hurdles to overcome. So there's quite a significant due diligence on our part. And that can involve doing site visits and having detailed conversations, a bit like mini accreditation visits, to ensure that the built environment is adequate and that the staffing levels, the skill set, and the responses to clinical deterioration are appropriate. And also the processes to escalate and to re-engage with the public system if that was necessary. And so we would expect our clinicians and our senior managers to be very, very closely involved in making sure that was suitable. Overall, I think that the point I would make is that in other jurisdictions, this is not an unknown thing. There are other states in Australia where private facilities do actually have people who are under the Mental Health Act, and so some of those organisations also have private facilities in New South Wales. So it's not like they have no experience at a sort of a national level, and essentially some private facilities have shown an interest and others are not, and that's a reflection of their sense of readiness and whether they've got the appropriate facilities.
The work that you're undertaking at the moment in terms of due diligence, has any external consultation happened as part of that work in terms of understanding what people with lived experience or their families might need from a private facility being used for this?
I don't think we've even got to the point of a firm proposal from any of the facilities that they're ready to go, and so the point at which there would be inclusion of a broader consultation would be if there was a readiness to go. We've been talking about it for a couple of months. It is not fast, and I don't want it to be fast. I think it's a very, very detailed, thoughtful process, and I think that once there is a level of comfort both from the provider and also from us, the purchaser, if you like, then that would be a time to develop the clinical pathways, which would include consultation with consumers.
Okay. Thank you. I've also got some questions about the virtual care hub that I understand was set up as part of the contingency planning for the resignation of the psychiatrists to give decision makers a view of system needs. How does that care model actually work in practice?
Thank you. Can I just check if the question is about the virtual psychiatry hubs?
So the information that's publicly available about both and either, it actually is unclear what the distinction is between those two things. So there was a lot of information provided about virtual hubs that were not for clinical care around, if I recall correctly, January. Please correct me if I'm wrong. I understand there's also hospitals being provided virtual psychiatry services. So one of my questions was whether or not this is even a clinical care model. So I think your question is actually getting to answering that.
I'm happy to answer that. New South Wales Health has a lot of virtual models across general health and across mental health, and has had for many years. Perhaps what's been mentioned in the media is specifically the virtual psychiatry hubs that have been stood up specifically in response to the issues with the psychiatric workforce late last year and early this year. And I'm happy to describe that, and if it's not answering, please let me know. The issue is the potential lack of senior clinical decision makers, particularly in metropolitan areas, should this resignation action, eventuate in more actual resignations, or places now where there is a relative diminishing in the number of consultant psychiatrists, and where that has not been able to be filled by locums. So there are some districts that have signed on to this model. The model, the way that it works, it's hosted by both Western New South Wales and Hunter New England local health districts, which were chosen because they've really got a lot of experience and expertise in delivering virtual mental health assessments and decision making across large parts of the state. They also have the technical infrastructure set up to be able to do it. This hub and those two districts as a part of it host a statewide model. It has employed, and I'd have to take on notice the exact number, but I believe it's employed somewhere between 6 to 8 VMOs, who I understand are all locums. Are all VMOs who have not previously worked in New South Wales. But when I say locum, they're on a VMO determination, as I understand it. The usefulness is that if there are services where there's a senior decision-making capacity that's not there or is diminished, that the psychiatrist can speak to, it's generally clinician to clinician. So it's, for example, it would help an emergency department, nursing staff member, occupational therapist, psychiatry registrar, who needs to discuss a consumer with a psychiatrist, but might not have access to that locally. It's not a replacement for in-person psychiatry coverage, but it's largely being used for clinician to clinician advice. My view, and many people share this view, is that in a distributed state, in a networked service that we have, it's actually a direction that we should be moving in any case, because we have whether or not they're currently public or currently private or currently elsewhere employed, most of our psychiatrists in New South Wales live in Sydney, and obviously the need is geographically across the state. So we're not saying it's going to replace face-to-face psychiatric care, but it is a really good measure in providing that capacity when it's not, or if it's not available. So it's a contingency plan, but it is something that strikes me as something that potentially could be quite useful. We're also very interested in looking at this model to make the lives of our existing staff specialists and hopefully future staff specialists much more satisfied and keener to stay with our services by using the model to mitigate some of the on-call demands. So when you talk to psychiatrists around New South Wales who have been or are still in staff specialist roles, one of the things that is the most challenging is the very high volume of calls out of hours for making decisions about consumers, usually in an emergency department. And we're very interested in exploring this model as a way to offset and to mitigate what has been a long-standing concern of our staff specialist psychiatrist group.
What's the feedback you've received so far from hospitals that have accessed the virtual model?
It's early days. There were some teething issues that I'm aware of at one district in Sydney, and I think the issue is a technical one, and what I have heard, although there may be others who have more details around it, is that there were ED department mental health clinicians who were having trouble accessing the hub because it was apparently reliant on one phone or one phone number. But I understand, and I'm happy to get back to the committee if any further information is needed, but I understand that issue has been sorted. So there was some difficulty initially in accessing. There was also it's a brand new model, literally weeks old, that's been stood up, in the middle of a significant workforce issue. So it's not unexpected there are early concerns, but it is now very clear that that service can see consumers who are involuntary, can see consumers who are voluntary, and is predominantly based towards giving other mental health clinicians or general health clinicians clinician to clinician advice.
It's heartening to hear you say that it's not intended to replace a psychiatrist in person or seeing a patient directly.
Yep.
There are obviously areas at the moment in the crisis that you're in where there isn't a service on site now, and this sounds like mostly a secondary consultation type of service.
Yes.
And, certainly as a former clinician, I appreciate there are many cases where that's a useful tool. But in terms of the consumers and their families who are accessing this, in terms of the clinicians who are accessing this, have there been any issues where a secondary consultation is not appropriate? What then happens if a patient actually needs to be assessed directly by a psychiatrist?
Yes, so in which case they would be, and that's where our locum psychiatric workforce comes in. So the virtual psychiatry hub is a part of the issue, and it's trying to address the concerns around other clinicians having a psychiatrist to speak to escalate clinical issues. But it is not directly seeing consumers, for example, in a unit or a more complex consumer in an ED who may need that, where that service is provided by psychiatrists in person. And if there has been a localised workforce shortage because of the industrial issues, then that is supplied by, usually at the moment, by a locum psychiatrist, which we hope is a temporary solution.
I've also got some follow-up questions. We had a discussion this morning around the impact of the resignation on psychiatric registrars in particular. I've got some questions. The answers are going to be numbers, so I appreciate they may need to be taken on notice. I'm interested in the number of advanced trainees who've completed their fellowship in the last few years and how many of those were successfully recruited into staff specialist positions. I think we'd all agree there's a goal to retain these people in the public health system. How many of them are still here?
I'd agree with you, that's a goal. I'm not sure if you've got any different information, Murray, but I suspect we'd need to take that on notice.
Okay, thank you.
Thanks.
Yeah, so to clarify, I'm interested in the number of recent fellows, say the past 3 years, the number of those that were subsequently recruited as staff specialists, and how many of those are still here, still working for New South Wales Health.
Yes, that's
Thank you. I've also got some more questions coming out of the community mental health inquiry that this committee undertook last year. There was a recommendation around data collection and information sharing, and in the government's response it said that New South Wales Health was finalising technical work for the Australian Institute of Health and Welfare to support the regular sharing of aggregated state and national mental health services data.
Yes.
Can you give an update on what's been done?
I would have to take that on notice because the data management falls outside of the mental health branch, but we're very happy to get back to you around that.
Thank you very much. And I have a follow-up question that I imagine will be sent to the same person.
Yes.
Particularly with the question of data, so there's public data that would be held by New South Wales Health in terms of mental health, but also a significant amount of data from community managed organisations because they're providing a large quantity of care in New South Wales. I understand that their databases generally don't interface with other systems, including the Australian Institute of Health and Welfare data. So the second question is if there's any work underway to ensure that data from those community managed organisations can be unified in whatever work's being done.
I do recall, and you can correct me if I'm wrong, but the Mental Health Coordinating Commission giving evidence to that effect at the inquiry, and concerns around non-government data sharing. I would have to take that on notice and very happy to get back to the committee around progress against that recommendation.
Thank you very much. I've got a couple more questions that are probably, that I anticipate you won't be able to answer off the top of your head, so please feel free to take them on notice. Are you collecting or aggregating any data around length of stay in ED for psychiatric patients?
Yes, we have live real-time data on length of stay for all patients who present to an emergency department. And that includes people who either initially or subsequently during their stay in emergency found to have what I guess would be primarily determined as a mental health presentation, noting that sometimes that's, as you know, unclear initially. We do collect length of stay data, and again, I'm not sure if if it's pertinent to your question, but one of the things we are very interested in the middle of the contingencies that New South Wales Health has had to stand up, is whether or not there's any indication of data performance dropping off, and we have not seen that statewide, which has been heartening.
Okay. Are you able to provide that data to the committee?
I would be able to provide that on notice, yes.
Thank you very much. I appreciate you taking that on notice. Rather than jump to a whole different portfolio, I might go back to the opposition.
Okay.
Mr. Fowler?
Thank you very much.
Yeah.
It's nice to have another minute. Mr. Cleary, could I ask you to pop up, please? Thank you, Mr. Cleary. Just interested in the consultancy spend of Hunter Water.
Yes.
So looking at your annual report, it seems like Hunter Water spends a bit in excess of $15.2 million per year on consultancies. Is that correct?
That was the number for last year.
Yep.
It's important to point out in terms of the reporting, there was a change in how we've been reporting our consultant spend. And for last financial year, we included in that reporting not only consultant spend from our operating budget, but also relating to capital works. And that's why there has been a material change in the numbers that we've been reporting. That's following Treasury guidance. There are new guidelines out. So we've undertaken reporting which for last financial year was optional, but will be mandatory for this financial year.
Okay. Thank you very much. So how many users does Hunter Water have? Like how
many customers?
Yeah.
270,000.
Okay.
That's properties. 600,000 people with the population we service.
Okay. And with respect to that consultancy spend of $15.2 million, that was material. So you're saying the increase on the previous year was as a result of those Treasury changes, is that correct?
Correct. From an operating cost perspective, it's roughly in line with what we'd seen in previous years.
Okay. And what were some of those ones that were now captured, those consultancy spends perhaps in the excess of $50,000 that weren't captured previously?
So, for example, we had a Belmont desalination project that was going through the design phase. So there are components of that design work which are considered advisory. One example would be advice we had regarding our planning approval. And it's actually a requirement of that process that we get independent advice on some of those matters. We've had work on dam safety that we were undertaking, and that required independent expert review that was included. So that was there's a range, but that the advisory nature of some of those engagements were along those lines. Often it's either seeking expert advice interfacing with a regulatory matter, or it's getting expert advice from technical experts in preparing our designs to go to market.
Okay. Thank you very much, Mr. Clear. I think that's it from you. Mr. Shrew, I might ask you to come up now as well. Just with respect to Sydney Water, with consultancies as well, I noticed yours was considerably lower at about 1.13 million overall for consultancies. Had you implemented the same changes in terms of Treasury guidelines for recognising consultancies in infrastructure?
Yeah, the guidelines are the same, yeah.
Yep, so you're implementing the same guidelines, are you? Yep. So it's effectively comparing apples with apples when you're looking at consultancy spends?
I would think so. Yep. Look, I would think so because the guidelines are the same. Now we've not exchanged notes with Hunter Water and compared what we put into these numbers.
Okay, thank you. And how many customers does Sydney Water have?
It's about 5.4 million.
Okay, thank you very much, Mr. Shrew. Okay. Hello, Ms. Pinkstone. How are you? We'll finish with water and come back to housing now. So just checking with respect to the budget allocations when it comes to social housing in New South Wales. Of course, Department of Communities and Justice, or Homes New South Wales, was allocated $1 billion for this financial year in the budget. Just wondering to sort of the mid-year point, seeing we're at mid-year estimates, how much of that has been spent to that point?
I'll take the exact number on notice. That budget is for homelessness projects, new supply, and also upgrades to our properties. So yeah, it's the full suite. So I can take the exact budget allocation from say December, and I can get that number back to you.
Thank you very much. Now, of course, we're in this position where we have Homes New South Wales as sort of the umbrella, but we still have the Land and Housing Corporation, we still have the Aboriginal Housing Office operating. Just wondering, how is that working within the organisation, and what are the discrete roles for each of the organisations, with Homes New South Wales now being in a position as well to outlay capital and the like to build homes?
So we also have another statutory authority, the Teachers Housing Authority as well. So we have 3 separate entities that deliver housing, and now we have the ability with the legislative change for DCJ also to have that capacity. So we operate essentially under one division within DCJ. Broadly, the housing portfolio team were called the Land and Housing Corporation before, are responsible for maintaining public housing properties and building new public housing properties. The AHO do the same for Aboriginal community controlled housing, and teachers housing for the Teachers Housing Authority. And now we have the capacity, I suppose, to bring that money through to DCJ and look more holistically in some of the partnership projects that we have in place with community housing providers, and also the development industry around large-scale redevelopment as well.
Very good segue there, because my next question was, in terms of that budget allocation, is it correct that 30% is earmarked for the community housing sector?
Well, that at the moment the sector comprises about 30% of the system in New South Wales, but we're looking to exceed that in our partnership approach, because we need to also take into account the fact that we have Commonwealth funding coming through, and that's largely through the sector. So I anticipate it will be larger than 30% by the end of the program.
And in terms of that funding, how will that be provided to the community housing sector? Will that be through grants or land transfers? Tenders for managing properties that are built by New South Wales government agencies?
There'll be
all of the above?
All of the above, really. Yeah, absolutely. So there'll be a number of pathways to deliver those partnership projects. We'll work with some of the larger scale developments, will be in partnership with developers. Community housing providers will have a role there as takeout parties of the social and affordable housing in those developments. There'll be a number that Land and Housing Corporation or Housing Portfolio deliver themselves. They will be managed as public housing, but there'll also be the capacity for smaller organisations that perhaps don't have the development expertise to become takeout partners in that. So there's a variety of mechanisms, and we've also have a sort of grant approach that can help smaller organisations that are bringing land to the table to do new developments for social and affordable housing. So the scale is such that we need to have all of those levers, and we need to engage organisations of different sizes in that program as well.
And what outreach have you had so far in terms of community housing providers in working how this delivery will look over the next 4 years?
Well, we've had significant engagement with the sector around the development of our program, and they've also provided written advice to us about the learnings from other past programs and how we could improve. And most recently, we've been in tender negotiations around projects that the state has put up under the Housing Affordability Future Fund. So significant engagement with that part of the industry to make sure that they're ready to take up the opportunities. Obviously, a big part of that for Homes New South Wales is we have access to a lot of land, and we have a lot of ageing properties, and so we want to work with the sector to revitalise that portfolio, and they'll have different roles depending on their scale and size.
Thank you, Ms Pinkstone. And with respect to the land audit, and I know we were talking about dibs before, and first dibs for Homes New South Wales. With respect to those properties that you do manage from the land audit, and as a result of that, will community housing providers have any role potentially in the management of those properties?
Absolutely.
Yeah.
So we're being quite strategic about the land audit sites. As you know, the major issue for us when we're trying to redevelop a portfolio is where do we relocate residents to. So we're trying to identify land audit sites that strategically help us unlock our own portfolio for redevelopment, and a number of those sites are of such scale that they would warrant social housing, affordable housing and market housing on the site. And that's definitely the pathway to partner with community housing providers so they can bring that external capital into the project and work with us on that site.
Thank you, Ms Pinkstone. And Ms Pinkstone, as close as you can to present, what's the current number of social homes in New South Wales?
I've got that data for you. In total, we have 23-24 figures. We're at 155,905, and that includes public and community housing and Aboriginal housing.
Okay. Do you have figures on how much of that total is currently inhabited?
No, not at the social housing level across all of those categories. For ours, for those that are public housing, let me just look at that.
So what would be the public housing number then?
The public housing, I have it here somewhere. I'll just take my time. Our occupancy rate at the moment is 97.2%, and I can get you the exact numbers on
That
notice.
would be great. And then of that 2.8%, what's the status of that? Is that do you have a breakdown in terms of how much of that sort of being repaired, being refurbished, being identified to be demolished, for instance? And
I can get that breakdown.
Yeah, if you could, that would be good. And otherwise vacant, of course. Now, in terms of course, the budget announcement is that there's $5.1 billion and to provide 8,400 new social homes. That still remains the number?
Yeah.
Yep. Now, at the end of that period, what's the projected number of social homes in New South Wales? Because I imagine that some of that figure will be replacing stock as well.
I can get that as a proportion of our entire portfolio. The main issue at the moment is that we will be going out to tender for those sites, and so the breakdown between community housing versus public housing, I'll have to take that. It would be a modelled number. It wouldn't be a reality number, but I can certainly get that for you on the model.
Okay. Thank you, Ms Pinkstone. And in terms of that profile as well, and I know the Minister made mention in terms of the Argyle estate and reduction of bedrooms and the like. Have you got any modelling in terms of the number of bedrooms that we currently have, and how many will be at the completion of that period as well?
Yeah, well, we will preference smaller dwellings, and I suppose a number of those sites that we've earmarked for redevelopment take ageing stock, larger properties, and then we're creating residential flat buildings on those, so I can get that for you at a broad number, what we're aiming for.
Thank you very much. And how many development applications have been submitted for new social housing properties since the 1st of September 2024?
I can get that for you. Some of those, as you're aware, we have self-approval powers, so I can get that breakdown.
That was going to be another question I had as well, in terms of since you've had those self-approval powers, how many times or how many properties have you approved using those powers?
I can get that for you.
Great, thank you. I might put that one on notice more specifically in the breakdown, and also for the Land and Housing Corporation Aboriginal Housing Office as well, with those self-assessment powers. Now, I might just return back to those questions I asked the Minister with respect to the land audit and those sites. noting that several of those sites were vacant blocks of land, and I think I take the Minister's rationale with respect to they didn't have enough bang for buck, I think was her assessment. Some of those sites, however, I think the ones that were in Camperdown, or I think it was Lilyfield Road, which is why it confuses me. I think it was Lilyfield Road, Camperdown, were actual actual terrace houses. Lilyfield Road in Rozelle. Why was it that it was determined not to take those properties?
I suppose our strategy, as the Minister said, is how can we maximise the amount of housing that we have for the budget allocation? The most, rather than just purchasing sites or smaller sorts of dwellings, the way that we can do that is through larger scale redevelopments, and also ensuring that the housing is fit for purpose. So for us, it's always a value for money question. Where should we spend that money? I know that it can give an immediate response, but for us, us constructing those homes, those new homes on our property, is usually the most cost efficient way.
Okay. So I take it in that as well, and there is a financial equation that's at play here as well.
Yes.
To buy, you would need to transfer, I shouldn't say buy in a sense, but transfer money from Homes New South Wales to Property and Development New South Wales,
yes,
in order to secure those sites. So it's not necessarily a free property, so to speak.
No, we have to purchase those sites.
Yeah. Okay. And that process of purchase, I undertake it that's with the valuation from the Valuer General?
That's exactly right.
Right. Okay, great, thank you. Now, with respect to some of the other properties that have been identified as part of the Building Homes for New South Wales program, so Rydalmere, the rezoning initiative there, so that's fairly large bang for buck site, I guess, at 26 Kissing Point Road and 266 Victoria Road in Rydalmere. Now, on the 1st of December 2024, that was a media release from Minister Camper. I note that Homes New South Wales, or the Minister wasn't on that release, but just clarifying, is that a Homes New South Wales project? Or
No, not at this stage.
No, it isn't? Okay, great, thank you. Has Homes New South Wales been in any discussion about that project at all?
No.
No? Okay. Thank you. Now, with respect to the Tilapia Three Sisters site, how many residents so far have moved into the Wade Street Towers?
That's still undergoing a refurbishment and
Okay.
getting ready. There's no tenants on site at the moment.
Okay. And what's the target in terms of the number of tenants to be able to move in to the
There's
property?
across the three, across that area, there's 148 homes in the Wade
Okay.
Street Towers. We're looking to get them online as quickly as possible.
Okay. Do you have a target date in terms of when you'll be able to
At the
welcome
moment,
tenants
we're
back in?
looking at the end of this year, so
Okay.
as quickly as possible.
Okay. And how much is budgeted in terms of the renovations there?
I can get that on notice for you.
Okay. Thank you. And in terms of that renovation and that use, is it the intention that the towers will remain as is, or is there further consideration of development on that site and further public housing usage and
The whole
renewal?
site is subject to a master planning
Yep.
process. At the moment, my priority is getting those upgraded and refurbished to move people back in. And then there's the broader work within Tilapia in terms of planning and we are proceeding to do that within Homes New South Wales, but at the moment the real focus for me is those 148 and getting people in vacant homes.
Okay. Thank you. And with respect to the agreement to dissolve the partnership with Fraser's Property Australia, when it came to the Tilapia Urban Renewal Project in October 24, was there any compensation paid by either party as a result of that?
No.
No? Okay, great. Thank you. And I'll leave that at that stage. Now, in terms of the assessment that the department does, how many new public? I think the minister mentioned about a target of 850 this year. Was it for
824 this year?
824 this year for new public, and that's public housing rather than social housing.
That's all housing.
Okay,
combined.
all housing. Yeah.
Yeah.
And what was the figure for the last financial year?
For the last financial year, it was, where am I? I can get that for you on notice. Sorry,
Okay.
I can't just find it here.
Thank you. And of that 824 in all housing, what is the breakdown between public and other housing? I'll put it for want of a better word, but I'm happy for you to enlighten me as to what it should be.
Yeah, no, public housing is right. I'll take that on notice. At the moment, the target within that for Aboriginal housing is 165 homes.
Yep. Okay, thank you. Now, with respect to page 2-9 of the infrastructure statement, which stated under lack capital maintenance, 700 million of this, being the 1.3 billion for maintenance, will be met from proceeds from land transfers from Homes New South Wales in the DCJ, sourced from the 4 billion new funding for social housing. Can you explain how this process will work in terms of meeting those budgetary inputs from those transfers?
Yeah, that's the reason that the legislative change was brought through, that the funding's going to DCJ, but in effect, because Land and Housing Corporation as an entity is separate, we need to be transferring it to that entity. So, yeah, that picks up on those issues you referenced about different statutory agencies within DCJ.
Okay.
Yeah.
So it's not in terms of any sort of sales or that will be funding that maintenance?
Technically it is a sale transfer.
Okay, but it's an internal transfer, nothing's actually
That's
moving.
right, it operates in the same way as between other government agencies.
Okay, thank you, Ms Pinkston.
Just before I come back to the Advocate for Children and Young People, I had one more question for Dr. Wright and Dr. Flynn. In our last discussion, you mentioned the pilot of redesigning after hours work for staff specialists, and I understand that was part of an offer that was made by the government, the staff specialist psychiatry pilot, in the negotiations with ASMOF and the College of Psychiatrists. Were there other aspects of that pilot that have proceeded?
Yep. Thank you. Thanks for the question. All of the aspects that were related and are related to reducing on-call burden are very reliant on a piece of work called the Psychiatry Workforce Plan that's been developed. It's now 4 to 5 years old and it's been refreshed last year. But that's been developed with input from the college, with input from memory, from ASMOV, certainly with input from multiple psychiatrists. I'd have to go back and take on notice what may have been part of the government's position for a efficiency package. But I certainly would say that we are very interested in making that role, separate to whatever happens at the IRC, a much more attractive role and to improve recruitment and improve retention. And some of that is, in our view, trying to support people in terms of making sure that the psychiatrist's time is used most appropriately, that their expertise is used in a way that is not duplicating, I guess, the clinical roles of others, and is actually trying to make the day-to-day life of a consultant psychiatrist in the system much more attractive and to improve what's been a long-term vacancy rate. And certainly that includes on-call, but it also includes what lots of our psychiatric colleagues tell us, which is that the nature of the role of being asked to independently see every consumer, when sometimes that's not required, to work at times with little administration support. There are things that we can do around that. So they're the sort of things we're very interested in doing to build a robust workforce noting, of course, that it's, the wage policy is for government, but in terms of what the system needs, we're very keen to design a role that is attractive and really becomes, we can't compete. We can't compete with a lot of the private remuneration that's out there. So what we want to be able to do is say, this is a role where your expertise will be valued. You won't be on call 24/7. You will have the opportunity to work in a multidisciplinary team, and your expertise, as well as that of your colleagues, will be used throughout its full scope. So it's a significant piece of work, but it's something we're very, very interested in doing. And it's a part of what we've been trying to communicate for many months now, which is that the role of a psychiatrist is and will remain central to mental health provision in this state. And none of the mental health clinical roles are interchangeable, so they're complementary. So we'd like to see all of our clinicians be able to operate through their full scope, appropriately supervised and feeling well supported in the work that they do.
Okay. Is my understanding correct from that answer then that there's a substantial part of that productivity and efficiently proposal, pilot, whatever you want to call it, that is actually progressing alongside or despite the wage negotiations?
So I guess separate to the wage negotiations, there are multiple things that we are looking at. We have had to look at contingency plans. We didn't ask the psychiatrists involved to leave. I understand many psychiatrists in New South Wales have had to make difficult decisions to leave or difficult decisions to stay. And we recognise that and we acknowledge that, but we emphasise that there are things we want to do to improve the role itself to make it more attractive. And that's a separate issue to the IRC, because as many of our colleagues involved in this action would say, it's not about money. So that's often said. And if that's the case, what it really becomes about is designing a role that optimises our services and gives the community the care that they need and deserve.
Okay, thank you. And you're able to get back to us on notice with some of the detail of that?
Around what, sorry?
Around some of the detail of that.
Yes, certainly I can, around anything that was offered in terms of a efficiency pilot or...
Yeah, so you hesitated in my first question, presumably because of the current IRC negotiations, but I'm trying to separate those two things and understand
I think, if I may, Chair, the workforce action plan that Doctors Wright and Flynn have been engaged in can provide quite a bit of detail to you on those very issues that were underway before the industrial process commenced.
Sure, but when you say underway before the process commenced, I understand there was a specific, it was called a productivity and efficiency pilot that was offered as part of the negotiations. I'm interested in those particular offers.
Some of those things from that plan, though, got picked up in that, so there's some overlap between the two things.
Okay, thank you. I might come across to the advocate. Thank you. You would have heard the discussion this morning with the Minister about trying to include a larger and broader range of young people's voices speaking directly to government. With your existing expertise in doing that kind of work or facilitating that kind of work, how do you, what would your recommendations be about how to do that on a larger scale moving forward?
So firstly, to note that the Office of the Advocate for Children and Young People, our age limit is 0 to 24, and that's very different to some of the other commissioners in other states in terms of age ranges, and there's over 2.5 million children and young people in that range, and so making sure that you are doing parts that children and young people can engage in regularly is obviously very important. Since the office, and certainly things to highlight, during that time, for example, during COVID, we were doing 2-week surveys with children and young people to understand how they were faring during that time, and that material was provided directly to Secretary's Board for people to understand and agencies to understand what was going on. So there are consistent ways that the office itself has been engaging with children and young people. In saying that, they themselves will be very clear about how they want to receive information and who best to receive that information from, for example. And so in the last strategic plan tracking report, they talked about having great trust with their peers, and we've also seen that increase in terms of the adults in their lives. So they talk more about receiving information from peer-to-peer, and then also the trusted adults in their space as well. They have specifically said to us, unsurprisingly, that government websites or apps are not something that feature in terms of where they would go for information, and we've seen that as well in terms of COVID and in, for example, the work we've done in disaster recovery about making sure you're using the platforms that young people are on. That also becomes complex when you can't access under the age of 16 and all of that kind of stuff. So there is some complexity around that. The key thing that they'll say is meet us where we are. So that means that it can't just be a government website. It can't just be one agency doing it. It means that you have to have a consistent plan about being in those places and having those conversations repeatedly with children and young people, and not waiting for young people to come to you to raise those conversations. And so I think that's a really key thing. It's not just about, just because we have an agency, and I reflect on this as being the advocate, that doesn't mean that creates a space for children to walk into or young people to walk into. You still have to go to them to ask them about the things that matter to them. And that's why as an office we're consistently doing that polling every year for the strategic plan, the work we did throughout COVID, but also the Youth Week survey to make sure that there is consistent tracking of children and young people's sentiment. And then if there's something particular going on that we need to talk to children and young people about, we're doing it in a way that means we're going out and having cost of living conversations where they are, and having those kind of qualitative conversations as well. So I don't think, from my experience and having this role for 6 years now, there is one way that you can do this. I think you have to engage where children and young people are, and that is in social media as well, and then also in a number of places. And you have to use the avenues that they say that they trust. So that means peer-to-peer and also the trusted adults in their life.
You mentioned the children and young people who are outside of your statutory age range. Do you see any particular barriers or opportunities to engage those young people in whatever new agencies created?
I think there is a particular interest in ensuring that range that is that kind of 24 to 30 is particularly engaged, because I think people, I'm not suggesting that ACYP should be doing that as well. I think we are fairly stretched as it is. But people are experiencing things like cost of living very differently. And so making sure that if that is still the number one issue, and it is, in the latest Youth Week poll that isn't out yet, so I'm sharing with you information that you will all receive soon enough, cost of living still presents as the number one thing. And so that means you need to be making sure that you're dealing with that for the age groups in where it's hitting differently. And interestingly, that is also being reflected in the younger age groups. So younger people are talking about cost of living, 15, 16-year-olds. And so that's why I think it's important to have an age range. Where it becomes difficult is when there are legislative changes or policy reforms that divide those groups. And so you see, kind of 0 to 12, 12 to 18, 18 to and above. And that is where I think for contracting and other things, it becomes really different conversations, because somehow you're dividing a group where globally, under 18, you're a child, but we now have children and young people, and so it just gets a bit more complex in that space.
You provided a fair bit of detail this morning about the work that went into the special inquiry into alternative care arrangements. I wanted to ask a similar question around the work that you've done on vaping. I understand you were part of an interagency panel and provided some advice to the Ministry of Health and the Department of Education. Can you share with the committee the process, I suppose, at the back end for you that leads up to that process and the work that you actually did to engage young people?
So it was something that I would say was kind of underway in the thinking of many places, and then that conversation started to happen where children and young people, obviously it recognised as being one of the biggest issues they're facing, and so our office was, I would say, not the first kind of port of call, but when we came into it, then it was very clear that we were needing to work very closely with all of the people that were doing that work, and that includes the Cancer Institute and health and schools. And so that was one of those examples where we hadn't done qualitative work, and so immediately went out to schools and sat with young people and asked them about their experience. And it gave us a really great opportunity to test some of the ideas government had at that stage with children and young people in terms of potential solutions. And so whilst it wasn't, it was kind of in a parallel process to things that were going on, but also we then had young people who assist in designing the health messaging that went out, and also have provided input into the app that is to be launched soon. I feel like I have an invitation to attend that, so it must be soon. And so the young people have now consistently engaged in that process. And we sit on the steercos and all of the government kind of mechanisms, but young people have provided some really great insight to that, as well as that young person attending the in-camera session and sharing with a committee their very real experience of their 3-year addiction to vaping, and provide some amazing insights into that, which could only happen if it was done in camera, because they didn't feel that comfortable sharing that very publicly.
I also understand you've done a lot of place-based work, most recently specifically in the Northern Rivers. How did you go about establishing that as a need, or that would be the location for this kind of work?
So in 2020, when I first took on this job, was the bushfires, and that was when we first did the report, The Voices of Children and Young People in Disaster. And we specifically included a variety of things, not just those bushfires, but obviously that had been what happened, but drought-affected areas and flood-affected areas. And in that, we heard specifically from children and the community that they wanted place-based responses for them as individuals and their experience of what they had gone through, but also that needed to be embedded in the community and be consistent, and not kind of that go in for 3 months and hope that helps in a school and then come back out. And so when what happened in 2022 happened, we worked very closely with Resilience, as it was then known, and the Commonwealth to identify that young people needed a different response. And so I think at that stage there were 6 pillars, and they were things like infrastructure and health, but there wasn't one specifically referring to the needs of young people. So together with our friends at Resilience, we worked very hard. We got that joint funding between the Commonwealth and the state. And we also made a conscious decision to make sure the people we employed were people who lived in that community. So we didn't just have people who were coming from Sydney going into the community. We wanted to employ people who lived and worked in that community, which has its complexities as well. And so they started 3 years ago, I think it was, maybe 2 years ago. And they were going to be based in schools, but then schools said to us, we are okay with the kids here, so we want to take care of them. So that's when we went to the pod villages. And the numbers of pod village, there was at the stage over 300 children and young people who were living in pod villages throughout that period of time. That's obviously gone down. And that was about making sure that we spoke to them, met their needs. We had a roundtable with those young people. We invited ministers in to hear directly from young people about their experiences, but importantly, their ideas as to what should happen next. And then that team remained on the ground providing, I suppose, a form of case management for those young people who had specific needs, to make sure we were connecting them in with the services that they needed at that time. And then that service now finishes on the 31st of March this year. And so we're in the process of winding that up and making sure those young people are being supported in community by other services. And we were actually there 2 weeks ago as part of the Advocates Tour. Communities and schools had asked us to come back into that. And so that was just as the cyclone was hitting. And so we sat with children and young people and had kind of very different conversations as well at that stage, and that was unexpected, obviously. And you could see that there was obviously still a clear need about their own feelings of what they wanted in that moment.
Given that the frequency and intensity of extreme weather events is increasing with climate change, what aspects of the work that you did in the Northern Rivers do you see as replicable in other contexts, and what parts of that were unique?
I'd like to think a core of it is obviously the community-led response, and community-based response is so very important. I think to the credit, the legacy pieces of what's happened as a result of the team being on the ground is we've now helped Ballina Shire to come up with its own response in terms of specifically for youth, and making sure the youth voice is on that space, which I think is amazing. I think the things that are easily, that government should take on board is those things in terms of the systems responses that we do. So for example, the payments that are coming out right now, there are things we know about people under the age of 18 who might be living independently that can make it difficult for them to access those payments. And so things that we've learnt about the structure of our responses are things that I think government is doing a very good job, I should say, of taking some of those on board. I think the difficulty is obviously every community has its uniqueness as well, and the things that they're doing in response to the things that might be impacting on them. So in bushfires, for example, down south, the things that they were focused on was Aboriginal-led environmental care responses, and they really invested in that. I'm not saying that hasn't happened in the Northern Rivers, but it's a different response when you're looking at bushfire regeneration versus a flood response. The flip thing is also that young people helped design the library as it was rebuilt. And so there's a youth corner that exists in Lismore Library that didn't exist before, and that was because young people were engaged in that process and feel like they can own that space. So I think there's core system things that can be rolled out broadly in response to disaster that children and young people need, But then I think you also have to respond to the needs of that community and what the children and young people are specifically asking for in that moment too.
Thank you. That's very helpful. I might come back to Ms. Pearce just for a moment because you mentioned the vaping app. Is there news or progress on this?
Look, I'd be very happy to report on that perhaps at a later time, noting that it's new. And I think, again, it's something we're doing along with our partners in this regard, noting the seriousness with which our whole organisation treats the vaping scourge that is in society. But yeah, I'd be very happy to provide you some more advice on that, Dr.
Thank you. I would also be interested in any feedback or evaluation on the public health messaging that's gone out so far with regard to vaping
Yes.
for young people, but also for the broader population.
Yeah, and look, I think as Ms. Robinson said, that it is clear that getting those messages right for young people is something that we're also focused on, about how we best communicate with them, noting that government sources aren't their favourite place necessarily. So we've certainly been looking at our social media activities around that, in addition to obviously all of the other work we do around vaping every single day out there, trying to get them off the streets.
And I'm interested to understand, since the ban on social media for young people, what kind of avenues are being looked at, or how is that public health messaging being targeted to try to meet its audience? Okay.
Thank you.
Is your nodding taking that on notice?
Yes, thank you. Sorry, I've become
Thank you, that's all right. I've got to clarify for hand side because the transcript doesn't show the nodding.
Thank you.
I don't think I've got a question to use for that last 30 seconds. 4.5 minutes? Sure.
Yeah.
It's 4.5 minutes.
Okay.
Overflow.
Great. Do you want to keep going then and do yours first?
No, that's right. You go.
Okay, sure.
You jump
I
and I'll go.
just to one for you, Ms. Pearce, and I wanted to just ask about, I suppose, contingency planning in terms of the psychiatrist workforce. And I appreciate the Minister gave evidence earlier about the IRC, or the industrial relations processes. But I suppose from your agency's perspective, what else are you doing in terms of contingency planning? I know you can't hypothesise on what the outcome will be of the industrial sort of process, but is there any more information you can give us about what else is being done to prepare for if some of those 100 pending resignations become real? What else? What other work are you doing?
Yeah, happy to respond to that. Look, I think we've talked about virtual today, so I won't go over that. I will make it clear, though, that is just one element. And again, I think to restate the point that we are never seeking to replace, human-to-human contact with virtual mediums, but that does play a very important part of our health system, and it will into the future. We have a range of things. So look, the locum work that we've done to attract locums for deployment has been part of it. Again, we're not seeking to have a locumized, if that's a word, workforce in psychiatry, but locums play a very important part of our system each and every day in many specialties. We've advertised for psychiatrists both here and overseas, noting that through the work that I've also been doing along with my colleagues across the country with the Health Workforce Task Force, there's an expedited pathway for psychiatrists from the UK in particular into the country that opened up in December last year. And, again, none of these are designed to be a silver bullet. I'll state again, I have personally written to our staff specialist psychiatrists 3 times. I've met with representatives. We've asked them please not to proceed with resignations and to stay with us while we work through this, through the appropriate process. And it's been very pleasing for us that the great majority of those people have hung in there with us, and I think that's important to note, as Dr. Flynn and Dr. Wright have already touched on. The redesign piece I do want to touch on, again, and it's very important for me to state on the public record, this is not designed to replace psychiatrists. Psychiatrists have a role, will always have a role in the New South Wales public health system. That is very important. We've made this clear to them in our communication. I have personally addressed the Nurses Association head office and made it very clear to them that we will not be asking nurses to work beyond their scope of practice. But nurses already perform highly specialised roles. We have 540 clinical nurse consultants in mental health across the state. We've got dozens of nurse practitioners, all of whom are well equipped to perform highly specialised roles, along with allied health professionals, peer workers and so on. So the redesign piece that we've been doing includes psychiatrists at the table, and indeed it includes the College of Psychiatrists at the table, and consumers who will be a very important voice as we continue to work through this challenge. We've looked at the international evidence in regard to these models of care so that we can understand whether the current model we have here in New South Wales can be further improved from learnings overseas. And, you know, so look, that is, I guess, a bit of a list, if you like, of some of the things we've undertaken. But I think I just feel like I need to restate it. There is no one silver bullet that we have sought to utilise during this period. We did not ask the psychiatrists to resign. We want them in our workforce and to be contributors to our workforce, and frankly everything we've done with respect to contingency planning has been in the interests of keeping our patients safe, and that includes the use of private beds where necessary. I will say that has been minimal and should not be overstated. But you know, we have worked with our private hospital partners across many challenges over the years, including during the pandemic. They're an important partner to us, as are our colleagues in Aboriginal Medical Services, NGOs, the list goes on. So I think we have a very robust contingency plan in place, but we've been clear from the start that if the full 206 psychiatrists resigned, it would be very challenging, and we have been open about that from the get-go, as has the government.
Thank you. Thanks.
Thank you. I'm still on mental health as well. So the gap analysis report that was done in December 2023 and was provided to the Mental Health Alliance mid last year, it's my understanding that there's a second report using the National Mental Health Planning Framework underway, looking at quantifying those gaps in more detail. Can you speak to the progress of that work?
Thanks, Dr. Cohn. Yes, I can. That work has now been completed and is with the Minister. I obviously can't speak for the Minister, but I'm grateful to our team who have used the National Mental Health Services Framework and also the Saxton Institute Clinical Services Planner, specifically to remember the first gap report was really qualitative responses from the sector, and I think that was presented at the inquiry from memory. I hope I'm not getting my timelines mixed up. The second one is very much a quantitative piece, and the Minister is currently considering that. That was just discussed with her last week, or possibly the week before, but just in very recent times.
Thank you. There'll be a supplementary question for the Minister about when that's going to be released.
Yes.
And thank you for the information you've been provided. So can I clarify that was done using internal resources at New South Wales Health to complete that work?
Yes, it was, yes.
Okay.
Yep.
And you've mentioned a couple of those frameworks that were used.
Yes.
The actual data underpinning sort of clinical gaps, is that coming out of electronic medical records, or what was utilised for that?
So essentially, and I'm going to describe this the best way I can, but I will defer to some of the experts in our team who work very hard on this. What the task is, so if I can be just describing some of these instruments. The National Mental Health Services Framework is a nationally validated measure of what the framework believes is the reasonable resource allocation for mental health services. It's impossible not to comment that no Australian jurisdiction has met that. with the exception of it being partly met, as I understand it, by one jurisdiction. So in absolute terms, it's an excellent goal, but it's probably more useful in relative terms for us to look at where there is less than average or less than comparable services available within our services, and also to compare them to other jurisdictions. Some of the absolute workforce gaps and differences are already public knowledge on the AIHW website. So it's actually quite useful in terms of assisting the Minister, I guess, with investment decisions. We think it's a useful piece of work. We are conscious that not everybody loves the framework. I think, all modelling tools are useful and none are perfect. But we chose it because it actually maps against the national strategy. It's well established, and it's really quite rich in some of the data that it can describe. But I would be the first to admit there are alternative ways to do that. There are other models out there. We did also use, though, the Mental Health Commission's commissioned SACS tool as well. So So I hope that assists.
It does, and I'm interested in your views on what the alternative frameworks would be.
There's an alternative framework, and I know the acronym. I'll have to take the full understanding of the acronym on notice. DESDAY, which comes from Canberra. So there's some excellent work done in Canberra around National Mental Health Service frameworks. National Mental Health Planning. That's an alternative model. It has benefits and I guess limitations like all of these models. I guess one of the things that we have heard from partners is that people would like to see more lived experience and care and consumer voices in all of those tools. Just an observation, I'm not sure that that's the case as much as people would like in any of them, to be honest. So there's a narrative around what's useful about them and what the limitations are for all of those. Yeah.
Thank you. Are there any questions from the government? All right. We will break for...
We don't have any more questions for Hunter Water or Sydney Water, I don't believe, and we don't have any for the Advocate either in the last session. But I don't know about others. But
yeah, just so that we can finish this conversation, perhaps not on the record.
Sorry.
That's all right. We might break for afternoon tea, and the committee might have a discussion around which witnesses we can let go when we come back from afternoon.
Sorry, I can normally just say
It's actually 3:46. Apologies. And we'll start with questions from the opposition.
Thank you very much. I might start with some questions around link to home, particularly relating to veterans, and whether or not there's been any changes in procedures following the Royal Commission inquiry into veteran suicides, and how veterans experiencing homelessness are managed or allocated.
Not directly. As you're aware, we have the Rent Choice Veterans product that's specifically for veterans, but also, as you can imagine, veterans are prioritised through the system experiencing homelessness, and that's the top of the priority on the social housing queue.
Thank you. In relation to the 8,400 social homes over 4 years, in that I think it's 50% would be allocated to women and children escaping domestic and family violence. Just wanted to get an idea of numbers and how that's tracking to date.
I'll take that on notice for the new supply 824 and come back to you for that. Yeah.
In relation to disability homes, you'd be aware that there is around 800, I think it's 804 disability former, they're managed by DCJ through Disability Services. I'm interested to know whether or not you've had any discussions around transfer of any of those homes that are currently used by disability providers.
I haven't. That's actually managed by a different part of DCJ through strategy, policy and commissioning, so I can take that on notice for you.
That's fine. In regards to the Mindari Street social housing development in Lane Cove, are you familiar with that?
No, I'm not. Is that the one that's is being undertaken by Link Wentworth?
It could be.
Yeah, I don't know the specifics of it, but I know that there is a development underway with Link Wentworth.
And I'm happy for you to take this on notice. In relation to commercial premises at that site, whether or not that's been considered, my understanding Homes New South Wales has had dealings in relation to its 86 apartments that are being built.
Okay, let me take that on notice for you in terms of the commercial.
And whether or not, if there's been any discussions held or if it was considered to have any commercial development on the site. In relation to Homes New South Wales and also DCJ's implementation of the Domestic and Family Violence New South Wales Common Approach to Risk Assessment and Safety, when it comes to housing and homelessness services, has any work been done in your area?
Not at the moment. We're part of a response across DCJ. We're doing some work at the moment to review our domestic violence policy within Homes New South Wales for public housing, and that's obviously taking into account the work that's underway more broadly in government.
And is there a time frame for that?
I can get that for you. It's I think it's before June this year, so absolutely.
And is that forming part of the homelessness strategy?
It's not forming part of the homelessness strategy. We've got a major review of all of the policies and so all of the major policies and procedures that have been raised by housing and homelessness peaks directly with us through our governance, and a priority forward for those policies to be reviewed. So not specifically the homelessness strategy, but more around our governance for the whole system.
Okay. Then so in relation to trauma-informed training that's provided to Homes New South Wales staff, is there actually training provided?
We do trauma-informed training, both online training and staff can also seek to have that face-to-face as well.
And does that also cover specific training for dealing with young people under 18?
I'll have to take that on notice for you.
And also the protocol around engaging with a young person, specifically whether or not if a young person presents who has said that they're experiencing domestic or family violence, what are the protocols about contacting parents or guardians?
Can I take that one on notice in terms of the procedure?
Yep.
Yeah.
Just see if there's any other homes ones. Could you explain to me what it means when it's described as, and I quote, closed for temporary accommodation access due to disengagement? What does that mean?
I don't know where have you
It's been raised with me that some Homes New South Wales staff will actually advise clients that are reaching out that the accommodation's closed due to disengagement.
I'll take that on notice. I haven't heard of that.
Okay, thank you. And also, if that is an option, what are the factors that make someone choose to advise a client of that?
Absolutely, yeah.
Just a couple of questions around the homelessness strategy. The action plans, I understand there's one due this year.
That we're aiming to have the action plans in this. So the timeframes for the homelessness strategy is we completed the external consultations on the 14th of February. We're now taking that information, including finalising the strategy and developing those action plans for the next financial year. So we've received significant feedback from homelessness providers, but also from people who have used homelessness services to inform our approach around the action plans, which will be quite specific around target groups, including young people and Aboriginal people, but more broadly how some of the themes of the homelessness strategy, including place-based initiatives, work in the broader system.
Mm-hmm. And what's the time frame for the final strategy to be released?
For next financial year.
Okay, so any time from June onwards?
Yeah, that's right.
Oh, July, sorry. In regards to the homeless outcomes measurement and reporting framework, what will be looked at in relation to that?
Yeah, so there's been significant work internally to look at the outcomes that we're seeking from homelessness services, and there's been engagement to date. We're looking at that work in I suppose in parallel to recommissioning and working through services. At the moment, we don't want to put extra reporting burdens on services that are already stretched in the middle of a housing crisis. They're really on the front line. So we're looking at how we think about that through recommissioning and embed those within a contracting framework that makes sense for services to be able to respond to and for us to track the outcomes of their engagement.
And has any work been done around flexible funding models at this stage, which was referred to in the draft strategy?
Yeah, so what we're doing is basically there's two elements of that. There's the core service funding that goes to the specialist homelessness services to run those services across the state, and then there's other buckets of money like the new money that came in, and the Homelessness Innovation Fund is a perfect example of that. Okay. So let's set up some funding that enables services to look at their own service models and things that might need to change, that they don't have the financial capacity to do that. Work with us on priorities, and as you know, the big priority for us is moving out of hotel and motel accommodation into supported homelessness services. And so creating a flexible bucket of money that can respond to both individual service needs, but if there is a need in a particular location, those services can come together and apply for funding jointly under the HIF is really important.
Okay. And the final one in relation to the strategy is the homeless register, and what will be recorded on that?
So we're doing some work at the moment. There is already, as part of the End Street Sleeping collaboration, a tool. We're looking at how we can take the principles of that tool and embed it so that it enables other communities across New South Wales to really track rough sleeping and be able to get live up-to-date information about people when they're on the street, their status in terms of whether they have a homelessness housing application, whether they were housed by us in the past. So that work's underway, and there's been various negotiations between local non-government organisations about who's best placed to manage that tool, and we're also now meeting with those parties to say what's the role of government in resourcing the tool and making sure that it has a broader applicability outside that one area to broader communities in the state.
Okay, that's fine. I'm happy to put the rest of mine on notice.
Okay.
Yep.
Chair, we are happy for the Advocate, Hunter Water and Sydney Water to be excused. Dr. Con, if there's no more questions for them. So, yep. There you go. Don't worry, everyone else. We might be out of here early for all of you. We'll see how we go. I just have probably one or two to you, Mr. Tidwell, and it might be Ms. Marr as well. Just in terms of the earlier questions I was asking the Minister about the youth agency coming in under, I guess, your leadership direction. Do you have any more information about what that will look like? And then the Office of Regional Youth staff, who I believe are still employed through Premier's department at the moment. No, they're not. Wherever I think there's still a number who are employed. I'm just not sure how many are still there and what their transition will be.
Yes, so look, the target date is to have this done by July the 1st. It is about, I think, a couple of principles are fundamental. The first is to remove fragmentation, to have an integrated office for youth, but in doing that, to ensure that there is no incursion into the integrity of the advocate, and that is well understood. In terms of the detail, I know it's mid-March, there is a lot to be done between now and June 30 in terms of that function elsewhere in government that is still to be worked through, but it will be worked through in coming weeks.
Okay, so are there still, as best as you're aware, Office of Regional Youth staff employed?
Yes.
And who, under where? Like, are they in Premier's department? Or
No, they are in the regional agency of government.
Right, okay. And then will they then presumably be transitioning to the new agency, or that's to be determined?
I think that is being worked through.
Okay.
Correct.
Thank you. But then I probably don't have any questions for you, Ms. Marr, and you're probably free to go as well, unless the chair needs you for anything. So there you go. Thank you. I want to come back now to water for the rest of the time that I've got. Just in relation to the Reconnecting River Country program, firstly, can you tell me what the budget is for compensation under the landholder negotiation scheme, and is that ring-fenced?
There isn't a budget as such under the landholder negotiation scheme for compensation. So the landholder negotiation scheme is really it's I guess more consultative than the Just Terms Act.
Okay.
The objective is not to have to rely on any compulsory acquisition. And the options that for modelling we've done, we're assuming that there are a greater proportion of landholders who will be minimally affected because the Reconnecting River Country program is a little confusing in that there's potentially decades of work in the whole program, but what we're looking at is what's to be done in the next 2 years, so to the end of December 2026 is what the Commonwealth has actually funded, and that program is a smaller program, so it's really looking at being able to run the Murrumbidgee water sharing plan at its full flow rate, and then a couple of other projects which are about raising bridges so that there's access during any inundation event. So it's a smaller set of potential flow easements that might be required.
Okay, and then in terms of, you just mentioned the Murrumbidgee work, is there a business case for that? My understanding is that was meant to be
There is a business case
already.
there's a business case for the final business case for the Murrumbidgee was completed just in January, and it's been through the INSW review, and it's also been submitted to the Commonwealth. It's been endorsed by both INSW and the Commonwealth, and we've had confirmation of an additional 123 million for that phase of work which I just described, which is the Murrumbidgee flow under the water sharing plan and the two other early works projects.
Okay. Just back very quickly to the Nyngan to Cobar pipeline, and I appreciate what you said earlier about the complexity of that sort of stage 2 of the project, and also that the Minister endeavoured to provide what she could on notice in terms of the business case. But just following on from that, is it possible, and I'm happy if you need to take it on notice, to get some sort of indicative breakdown of that $300 million estimate? How much of it is sort of engineering costs in terms of material, construction, labour, versus regulatory and compliance, planning and admin costs?
So, as the Minister mentioned, we are the Minister's asked us to look at what we can release, and that's what we're endeavouring to establish. So, of the estimated cost, how could we present that information?
Okay, that would be great, thank you.
I should mention that stage 1 of the work, which is currently in progress and is about $49 million, that is about replacing the pumping stations.
Yes.
And the electrics that support those pumping stations.
That was going to be my next question.
Yeah, and so that work, together with the assessment we've done of the 2 existing pipelines, there are 2 parallel pipelines, confirms that there's at least 10 to 50 years of life, if you like, in those 2 pipelines. And so our first focus was making sure that Cobar's water supply was secure. And so stage 1, we're confident, does that.
Okay, and so with the 2 pump stations, will they be operating below capacity because there won't be the new pipeline, or will there be an impact there?
No, they will operate with some capacity. So, yeah, they're being designed such that they can deliver the demand that is the current demand and a little more. So, yeah,
Okay.
they'll be fit for purpose.
Okay, and I think you just said, but just for clarity, not anticipating any implications on other sort of upstream projects.
So the demand of the mines, as well as the demands of Cobar, will be absolutely supported by the new pumping station capacity.
Okay.
Yeah.
Okay. What about the Dubbo to Nyngan pipeline or the Lake Rollins to Carcoar Dam pipeline? Is there any sort of implication there?
No.
Okay. Okay.
No.
No, that's right. I'm just going down my list of questions.
Yep.
So thank you. The draft water sharing plans and prescribed wetlands, which I know the Minister, I think last week, put out an updated media release in relation to that work. Are you able to just tell me how many proposed prescribed wetlands have been removed from water sharing plans across the state?
So what we're talking about is water sharing plans that are still draft and on display. So what we have done is extended the consultation period, identifying that a data layer that was first published in the first consultation period had errors in it. So there have been a significant number of wetlands taken away from the new maps that were published recently. We had a webinar just this week, and the consultation on the new maps that have been published runs to the 23rd of March. I could tell you catchment by catchment the difference in maps.
Do you want to maybe take that on notice?
I can,
Yeah, that might be
but
better.
I do have that information here if you wanted to know.
Yeah, so one of the concerns, I guess, that's been raised with us is from a landholder perspective, in terms of making sure that everyone is aware of the proposed, I guess, prescribed wetlands. You know, you just said that there's been some consultation, or that consultation process will be sort of extended, but are you confident that all landholders will have the information that they need as part of the process?
Confident that the maps that we've published, the revised maps, they're interactive maps. You can go in and you can check exactly what wetlands are being included. So the categories of wetlands that we're proposing to include in these new draft water sharing plans are Ramsar wetlands, are the wetlands in the Wetland Atlas, significant wetlands that have been identified through public consultation, through the floodplain management plans that we have been doing, so Murrumbidgee in particular, and if a wetland was previously identified in that water sharing plan. So they're the categories of wetlands that are now in the new maps that are on public display.
And just lastly on this one, if the plan is the aim is to finalise the plans rather than the plan is to finalise the plans. The aim is to finalise the plans by the 1st of July. If after that date an affected landholder might discover that there's been, an area or a wetland that's been incorrectly mapped, what's the mechanism or provision for that to be looked at post that 1st of July date?
The Minister could make a decision, if it's in the public interest, to change the water sharing plans so that wetland wasn't referenced. But I think the Minister is waiting to see what comes back from this extra consultation on the wetlands to make a decision about how she goes forward. I should also mention the Minister for the Environment has concurrence, as you know, on all the wetlands, so that those decisions are yet to be taken by both ministers.
Okay.
Yeah.
Thank you. I think that's my time. Yeah, I'm good. Yeah.
Thank you. I just have a couple of questions left, and we may be able to end the hearing after that.
I'm happy to
position. My last two questions for mental health again. As you may or may not be aware, the Ramsay Clinic in Thirroul that used to operate the specialised trauma service for women is no longer a specialised trauma service, and it's my understanding that there used to be one bed made available for a public patient at that facility. Since that change was made, has the Minister asked you to do any work looking at a centre of excellence for trauma-sensitive care in New South Wales, or finding a replacement for people who might require inpatient care specifically for trauma?
I think the answer is no. I can certainly double check, and anything else would come back on notice, but I'm not aware of any requests around that.
Okay, thank you. And my final question is about the Nolan House inpatient unit in Albury-Wodonga, which Albury-Wodonga Health is operationally considered a Victorian health service, but of course it's still a gazetted mental health facility under the New South Wales Mental Health Act, and it's physically in New South Wales. I had significant difficulty getting documents from Albury-Wodonga Health, including through the powers of the Legislative Council to compel documents. So in particular, I had sought service policy reviews that had been recommended by a coronial inquest, and in response to that order for documents, rather than being told that they were confidential or privileged or cabinet confidential, etc., I was actually told that there were no documents in the possession of New South Wales Health. Since then, the Minister's Office has assisted in obtaining some of the requested documents, but not all of them. But it raises an interesting oversight question. This is a gazetted facility under the New South Wales Mental Health Act that is physically in New South Wales. How is it possible that documents relating to the governance of that mental health unit are not in the possession of New South Wales Health?
Thank you. So I am aware of the requests that were made, and I can't speak for any documents that the Minister may have been able to provide through their office, but I do recollect that the Ministry of Health did, from memory, I think it was a Section 52 request, explore what documents we had, and we had a nil response. I can understand the nature of your question. I'm also conscious that operationally it's a Victorian service under the MOU. So I guess that's as much as I can answer. But I was aware of the request, and I can't speak for what the Minister's Office separately may have been able to obtain or to forward to you.
Thank you. Yeah, but look, I've been really pleased with the Minister's cooperation in obtaining some of those documents. I suppose it raises some questions about the MOU itself. If, as a result of that MOU, New South Wales Health is not in the possession of some of these were very basic policy and procedure documents for the mental health unit, which operates under the New South Wales Mental Health Act. Have you been tasked with any work to actually look at how well that MOU is working and your level of oversight of Nolan House?
I might take that on notice, and if there's any further information, we can get back to you around that.
Yeah.
Okay.
Thanks.
Thank you very
Happy
much.
to come back on. I mean, the MOU does require them to follow New South Wales Health policy. So we can certainly come back on it around the oversight function, if that's what you're seeking, Dr. Con.
Yes. Thank you. Yeah, to clarify, the nil result for the call for papers has given me concern that you're not able to exercise appropriate oversight under the MOU as it stands, seeking your view or your clarification of that. Please. Thank you very much. With the consent of the opposition.
Yes, we're happy to put it
in
on
the
notice
hearing
on Friday afternoon for it.
We will.
Dr. Con, I just have a couple of responses to Mr. Farlow in terms of data that he was asking for. The tilapia budget for the upgrade of the towers, $20 million has been set aside for that work. In terms of self-assessments, since January 2024, LAC has self-assessed 37 projects, that's about 400 dwellings, and the AHO since 2023, 40 homes. And then finally, just in terms of the data you were asking around the vacants, as of the 31st of December, 1,490 public homes were vacant and undergoing restorations to be returned straight away into allocations for tenancies. That's about 1.6% of the public homes. And then the remaining 1,041, which is around 1.1%, were vacant, long-term vacants related to redevelopment or major structural repairs work or fire damage.
Thank you very much.
Thank you very much, and appreciate all of the time that you've given up today to answer our questions, particularly noting it was very hastily rescheduled from last week because of Cyclone Alfred. Thanks so much for your time.
Thank you.
Thank you all.